Welcome back, everybody, to the second part of the fifth day of the Knowledge Festival, number 1. So, sorry, the sixth day. It's the final day, day 6. I'm losing count here. So no problem. We're here with the final stage of the thought process. So now we are getting to the challenges in the field. Now we had the therapies that come out of whatever we found out over the week about the immune system and the workings of the immune system and the ways of each of the medical systems we had here. We'll look at certain things and go about things. And now we're getting to the part where we see what are the challenges in the field and what will be the steps to take. Before we get to our discussion with some great minds, we will have 4 papers, as I see, or 5?
5, yeah, we have 5.
5 papers, yeah, 5 papers that we really love to get into the program, into action before this first Knowledge Festival is over. So we will start with Vinayak, who will be our first runner.
Dr. Nida Sumbul.
Dr. Nida Sumbul from the Unani section. The first paper on a significant immune boosting regimen of Unani medicine. Along with the sun bath, which we had a little bit of before, not from the Unani section, but now from this side, which is great. So, Doctor, please go ahead. It's yours.
Okay, sir. Thank you, sir. Good evening, all of you. First of all, thank you for giving me this opportunity. I am Dr. Sumbul Nida, Department of Amraze Jil wa Tajiniyat, National Institute of Unani Medicine. And this is my topic. Tazhabil Shams. Next. Tazhabil Shams, also known as Hammam-e Shamsi or sun bath or heliotherapy, in which the person is advised to expose the body to the sunlight. It is one of the regime of Ilaj bi Tadbir. Question is, what is Ilaj bi Tadbir or regimental therapy? Literally, Tadbir is an Arabic word, which means regimen or systemic plan, whereas Ilaj means therapy or treatment. Thus, Ilaj bi Tadbir means treatment through a special regimen. Through Ilaj bi Tadbir, care of sick person and maintenance of general health is performed with the help of certain procedures, tools and equipment described by Unani physicians. Other regimens like hijama, cupping, riyazat, exercise, dalk, massage, qay, vomiting, hukna, enema, fast, venesection, irsale alak, leeching, etc. And hammam is one of them. Modalities other than Ilaj bi Tadbir are Ilaj bil Dawa, pharmacotherapy, Ilaj bil Ghiza, dietotherapy, and Ilaj bil Yad, surgery. Next. Before discussing Hammam-e Shamsi, we have to know about Hammam or what is Hammam. Hammam is derived from the Arabic root ham, which means spreader of warmth or they produce heat. In Unani system of medicine, the term Hammam refers to hot bath. There is many types of Hammam like Hammam-e Barid, cold bath, Hammam-e Bahri, sea bath, Hammam-e Har, hot bath, Hammam-e Sabusi, brand bath, Hammam-e Bukhari, steam bath, Hammam-e Ramli, sand bath, etc. And Hammam-e Shamsi is one of them. It is an act of sitting or lying in the sun, especially UVB rays. This regime can be taken by all people of all ages and all genders. Next. There are many benefits of Tazhabil Shams or sun bath. First, boost immunity. It is an old method to treat autoimmune diseases. We all know that it's a natural source of vitamin D. Reduce depression. Sunlight elevates the level of serotonin hormone. This hormone boosts our mood, helps a person feel calm and focused. Fourth, better sleep. Sun bath helps in the production of melatonin that helps to improve the quality of sleep. Stronger bone. Sun bath helps in better absorption of calcium in the body. Healthy looking complexion. Fourth, metabolize cholesterol. Because cholesterol is used in vitamin D synthesis, level of cholesterol will reduce as more vitamin D is made. Keep blood pressure normal. Hammam-e-Shamsi or sun bath helps in activating the nitric oxide that control cutaneous microcirculation by widening the blood vessels in such a way helps to keep blood pressure in check. Heal skin problems. Tazhabil Shams or sun bath is useful in treatment of many skin diseases like psoriasis, vitiligo, etc. Keeps diabetes in check. Due to vitamin D production, control insulin level in body. Keeps relaxed and calm. Sun bath calm muscles and help in the cognitive development of the brain. Improve function of liver and kidney and lessens the chance of Alzheimer's. Next. Vitamin D has numerous effects on cells within the immune system. Sunlight is composed of ultraviolet, visible, and infrared radiations. It is essential for life on Earth as a source of energy, light, and warmth, and to maintain oxygen levels in our atmosphere due to the role it plays in photosynthesis. UV-induced immunomodulation, an immune response triggered by UV radiation affecting the skin first and then the whole body. The effects of vitamin D on human adaptive immune cells demonstrated on expression of the nuclear vitamin D receptor as well as vitamin D activating enzyme in both T and B cells. Next. Vitamin D may come from three potential sources: UVB-dependent endogenous production, nutritional, and supplements. In human, vitamin D is mainly synthesized in the skin after exposed to UVB. In a recent review, 4 potential mechanisms by which vitamin D may influence T cells function have been proposed. First, direct endocrine effects on the T cell mediated via systemic calcitriol. Second, direct intracrine conversion of 25-hydroxy vitamin D to calcitriol by T cells. Third, direct paracrine effects of calcitriol on T cells following conversion of 25-hydroxy vitamin D to calcitriol by monocytes or dendritic cells. Indirect effect on antigen presentation to T cell mediated via localized antigen presenting cell affected by calcitriol. Vitamin D may not only support the innate but also the adaptive immune system. It's the figure. Next. These are the some factors that affects the production of vitamin D. First, time of the day. At noon, the sun is at its highest point and its UVB rays are most intense. That means you need less time in the sun to make sufficient vitamin D. In other words, we can say when shadow is shorter or the same height as you, like between 10 to 4 p.m., UV rays stronger during spring and summer months. Second, amount of skin exposed. Need to expose a sufficient amount of skin to sunlight. 10 to 30 minutes per week is sufficient for lighter skin people, while darker skin may need longer. Skin color. Darker skin people have more melanin that protect against skin damage by reducing the amount of UVB light absorbed. Darker skin people need more time in the sunlight. Fourth, geographical location. People who live farther away from the equator need more time in the sun as more UVB rays are absorbed by the ozone layer in these areas. Next. These are some factors those prevent vitamin D production. Wearing sunscreen may reduce the ability to production of vitamin D. Second, body can't make vitamin D when exposed to sun's rays through a window as a glass blocks the sun's UVB rays. Third, aging reduces vitamin D production in skin. There is a decrease in the concentration of 7-dehydrocholesterol in the epidermis in old compared with young people. Fourth, darker skinned people. And fifth, people with liver and kidney disease, because ability to produce vitamin D become reduced, like in case of chronic kidney disease or chronic liver disease, etc. Next. These are the indication of Tazhabi Shams, sunbath. Respiratory distress condition, particularly in asthma, cold, or catarrh, COPD. Vitamin D has a potential antimicrobial activity, and some studies provide evidence that vitamin D deficiency may increase the risk of viral infections such as the influenza, respiratory tract infection, and HIV, suggested that vitamin D possesses antiviral activity also. Insomnia, rickets, osteomalacia, depression, rheumatoid arthritis, vitiligo, psoriasis, atopic dermatitis, etc., neonatal jaundice, and scabies. This sunbath is an excellent way to get rid of mite and obesity. Next, conclusion. Purpose of this article or presentation is to make awareness and to update the knowledge of Tazhabi Shams, which have been used by our Unani scholars since antiquity, as it's a natural source of vitamin D, which boosts immunity and also helpful in many autoimmune diseases, skin diseases, and other systemic diseases, as well as sunbath is indicated in respiratory distress condition. Recent studies also reported that vitamin D had 12% lower risk of developing respiratory tract infection and its deficiency prone to 77% COVID-19 infection. So this regime of Unani system of medicine is scientifically proven in several ailments, can be used as immunomodulator. Thank you.
Thank you very much. That was great, structured, and this is a very interesting idea of the sunbath. We already had it from a different system, from a different way to look at it. Just go back through the video. There are certain details that you should think about. Don't just jump into the sun, and the more sun, the better. Just really take care of the ways that also Dr. Sambol was telling us, but also just be aware of your skin color and the intensity of the sunlight. As I said, we will have these clips separately put out, so then you can go through those that are about sunbathing and just take out all the information before doing it. And of course, this is something that yes?
No, sir.
Oh, okay. So thank you for your time and your great work. We will move on to the next paper, which is, who is our next presenter?
Dr. Lavya Shetty from Yoga.
Good evening, sir.
Good evening,
Good evening.
Doctor. All right, without any further wasting of time, let's move on. We have to give everybody the right amount of time to do their presentation. So go ahead, Doctor, please.
Yeah, thank you, sir. Thank you very much. First of all, I heartily, welcome you all for my presentation, and I have to special thank to Dr. Vinayak, sir, for giving me this opportunity at the last moment to present this topic. Before I start with the topic, I have to just brief you that I have presented this paper on my small work which was done on adolescents. So the title of my presentation is Effect of Yoga on Cognitive Functions Among Adolescents. Me, Dr. Lavya Shetty from Division of Yoga, Manipal. So next slide, please. So I'll go to the brief introduction about what is the mental health. Mental health is a state of well-being in which the individual realizes his or her ability which can cope with the normal stresses of life, work productivity, and make a contribution to community. Next slide, please. Memory, attention, language production, and comprehensive learning, problem solving, reasoning, and decision making are the example of cognitive performance, which is very important for adolescents. Adolescents' cognitive development is influenced by various variety of factors, including the psychosocial environment, socio-economic status, nutrition, family, and environmental factors. The cognitive mechanism required for goal-directed cognition and actions are referred to as executive function. The recent study shows that aerobic exercises improves children's executive function. The next slide. So we opted yoga. As you know, yoga is an ancient traditional practice that involves mind and body activity. It incorporates not only physical posture, breathing technique, meditative activity, which brings not only the physical, mental, and emotional wellness and also togetherness. As the definition of yoga suggests, the union of Jivatma with Paramatma, that is, the union of individual self with the transcendental self. It is beneficial the yoga is also beneficial in enhancing mental health and consequently cognitive growth. It is reported that regular practice of yoga has reduced stress and also help in improving the academic performance in school children. Next slide, please. Yoga has multiple benefits, as everybody know now, that it improves the mental health, it increases muscle strength, flexibility, improves the respiratory function, cardiac parameter, reduction of anxiety, stress, depression, also improves the sleep, improves quality of life. Along with all these benefits, we have also certain benefits as in it automatically massages the internal organ, improves digestive function, circulatory function, respiratory function, endocrinal, neurological, and excretory system. Next slide, please. In the current era, we all know that it is technology-based and technology-driven. So there is general lack of physical activity, especially in school-going children. Hence, there is a need to incorporate a structured program that is cost-effective and easily incorporated into daily activity. Considering all these multiple benefits of yogic practice, we developed a small yoga module which can be readily incorporated in daily activity. Our study aims to evaluate the effectiveness of yoga intervention or cognitive ability of adolescents. Next slide, please. So our material and subjects will go through all these things one by one. We have used tools like digital span forward and digital span backward test, letter number sequencing, and I'll be just briefing on yoga intervention, what we have used, and what was the statistical analysis which we found. Next slide, please. So the subjects which we used were, we conducted one group intervention, pre-test, post-test, among 36 adolescents aged 12 to 13 years, that is grading to 7, a rural residential school in Udupi, Karnataka, South India, as there was very difficult to get the permission from the school. We got very, only 1 to 2 schools which was giving permission to conduct the intervention. In the Indian educational system, we consider 7th grade to be from the primary to high school, which is very benchmark. And during this period, students face a lot of cognitive challenges due to the abrupt complexity in the academic curriculum. Hence, we hypothesized that yoga intervention might be helpful to the students to improve their cognitive ability. Due to the potential benefit of yoga on general well-being, we have not considered the use of control group in this study. Next slide, please. the permissions which we had to take from the ethical institution of Manipal. Then once we got the ethical permission from Manipal, we have registered it to clinical trial residents of India. Prior to the subject which were conducted, we took a consent from the parents, and a said consent was sorted from the adolescents in 7th grade, and those willing to participate were included in the study. We excluded those participants who were already practicing any form of yoga daily. So the next slide, please. So as I told, we use two tools here. That is, one is digital span forward and backward test. That is WISCOMS 4, that assess the auditory short-term memory, sequencing ability, attention, and focus. Digital forward test is used to examine the rote learning, memory, attention, encoding, and auditory processing. In contrast, the digital span backward test assesses working memory, information transformation, mental manipulation, and visuospatial imagination. The next says about the letter number sequencing. Its task involves the sequencing mental manipulation, attention, short-term auditory memories, visual spatial imagination, and processing speed. The single trained and calibrated investigator administered in the form of questionnaires as per the standard guidelines in the quite isolated room at the baseline and after 12 weeks. So before I go to the yoga practice, as I said, a questionnaire was given to the students prior to the study and after 12 weeks. Once the questionnaire was given, as the assessment was completed, we gave a yoga module, which was priorly, discussed and formulated. And the postures involves Swastikasana, Vajrasana, Supta Vajrasana, Tadasana, Trikonasana, Paschimottanasana, Purvottanasana, Makarasana, Bhujangasana, Shalabhasana, and Dhanurasana. All these postures will not only help in improving their physical, but also the mental ability, and followed with pranayama, which is basically for the breath control to improving the respiratory function. That involves the alternative breathing technique, that is Anuloma Viloma Pranayama, one nostril breathing, that is Surya Vedana, followed with the Kriya that is called as Kapalabhati Kriya, and a relaxation technique called as Shavasana. All these were conducted for at least 1 hour and continuously for 5 days in a week for a span of 12 weeks at the school premises only. Next slide. The analysis which was done, all the data were analyzed using SPPS version 20. A p-value of less than 0.05 was considered to be statistically significant. We used the Speculo-Wilk test to check the normality of the data, and comparison of the mean value of the outcome scores were made using Wilcox-Stein rank test. Next slide. Coming to the results, as we had no dropouts because only few students were there, and it was compulsory for them to be enrolled. So there was no dropout, so we didn't have much difficulty in getting the data, and all the participants who were in the group were appear to be very healthy, and were the 7th grade students only. Our students included 9 of boys and 17 of girls with a mean age of 12.19 plus or minus 0.04, that is 0.04. And comparison of mean digital span forward test and the backward test and letter number sequencing significantly higher scored in post-test than in pre-test. We have got that result of improved in the post-test, and continuous yoga practice over 12 weeks showed very good result in cognitive function. Next slide, please. Okay. Coming to the discussion, we aim to evaluate the effect of yoga on attention memory among adolescents. The objectives were to examine the difference in the level of attention and memory before and after yoga intervention. We hypothesized that there would be no significant difference in concentration and short-term memory due to yoga intervention. Next slide, please. Our research showed a significant improvement, as I said, in cognitive, that is attention and memory, reflected by higher score in digital span and letter number sequencing after 12 weeks of yoga practice. The results are in agreement with the existing literature. However, direct comparison of the finding of our study was not possible due to substantial variation in socio-demographic characteristic and outcome measures used. Nevertheless, the cognitive outcome showed improvement when yoga is practiced among children and adolescents. Next slide. Coming to a few literature review which we did before we started this study, few studies shows that who practices Raja Yoga is the same practice method which we saw in this. For a longer duration, it shows a significant fewer neurological symptoms, scored higher on hope and happiness and cognitive function than those who practice Raja Yoga for short duration. So I specify that you have to practice it for longer duration to get a positive result. One more study showed that the higher cognitive function, that is on concentration, attention, working among children practicing yoga and meditation. Narendra et al. Concluded that yoga practicing group showed a significant improvement in various cognitive function among adults, reported a significantly higher concentration level and improved short-term memory among adolescents who practice yoga for 7 weeks. Next. However, few studies reported a lack of significant improvement in cognition. Chaya et al. Reported no significant difference in the cognitive performance between the yoga and physical activity group at the end of 3 months among 7 to 9 years old Indian children. Kimbrot et al. Reported that inverted yoga practices, these are the practices which causes the circulation improvement in your the higher centers, has no significant influence on memory among college students in US. Ferrario conducted a systematic review to evaluate the benefit of teaching yoga at school. It included 3 randomized trials that evaluated cognitive improvement, that is attention, memory, and development ability for calculating effective size, which favored yoga over the control group. Next slide. Studies have also shown that yoga and physical exercises are variably additions to school routine. The current study, what we did, found that yoga training improves cognitive function. Yoga is a simple and low-cost, effective adjuvant modality. It can be readily incorporated into curriculum to improve concentration and memory while maintaining physical activity. Further research on large scale over an extended period would help to generalize this finding. As I said, what was a drawback in our study was a sample size which was very less because we didn't get permission from other schools, which we tried a lot. So coming to the result, as you can see the table, which says about the digital span in pre-test and post-test, whereas the post-test shows a significant improvement after the practice of yoga. Next slide. These are my references, which we took for the literature review. Finally, to conclude, as I said, yoga is, excellent practice method. Not only yoga, even physical activity, which should be incorporated in school and to improve the cognitive ability of the students. Thank you.
Thank you very much. That was an important one also because this is something that actually everybody can do. As far as they get to do some yoga, they can try for themselves, and I think it could be helpful if you just take your time for a few minutes every day for maybe 1 or 2 weeks and see what happens to you and your body. And anyway, this was a scientific kind of research that maybe should go on and be done more frequently and in more places. So thank you very much. We are coming to the next presentation, the role of Urai Matirai, a Siddha polyherbal formulation as an immunomodulator in children, presented by Dr. Panir Sivan, a Siddha professor at the Sri Sairam Siddha Medical College and Research Center in Chennai, in India. So, Doctor, it's all yours, please.
Doctor, are you here?
Oh, possibly fallen out. So
maybe we go to the next one in the meantime.
Right. In the meantime, we can change and postpone this one. So let's see. Who is the next?
Sir, can I audible, sir? I'm Dr. Paneerselvam.
Oh, he's here. Great.
Sorry, sir.
Yes, okay. now you're audible. We didn't find you.
Yeah, sir.
There you go. It's all yours.
Yes, sir. Sorry, sir. Good afternoon, sir. Good afternoon, one and all, to the Knowledge Festival team, sir. And my very good afternoon to my dear senior Dr. Arula Madan, Professor, sir. I am Dr. N.R. Paneerselvam, presented here a role of Urai Matirai, a Siddha polyherbal formulation, sir, as an immunomodulator in children, especially in the time of pandemic now, sir. Please, next slide, sir. Yeah, introduction. Children are the heart of the fears around a possible third wave of COVID-19 in India. During the second wave of COVID-19, the virus had mutated and showed higher infectivity, and yet the Delta variant has caused much anxiety among Indian parents. As we are all know about, ACE2 is the main receptor for the entry of SARS-CoV-2 into human cells. It has also been postulated that children have ACE2 receptors with a lower affinity to the SARS-CoV-2 and a different distribution across the body sites, making the entry of SARS-CoV-2 into cells more difficult. It is one of the main reasons why children are not affected very much around the world in past 2 waves or 3 waves around the world. Now we will expect third wave in India and all over the world. It will target pediatric population, and especially in India, it will target pediatric population and also rural population. The Indian Academy of Pediatrics says that children are susceptible as adults and older individuals to develop infection, but not severe disease. Currently, India has no COVID-19 vaccines for children. This could be a reason why more children may be impacted in subsequent ones. Maybe it will introduce in India by March 22. COVID vaccinations for children in India in March 22. Warning sign indicates when a large number of children get affected, they may develop MISC, multi-system inflammatory in children, that could lead to deaths among children. It will cause after 4 to 6 weeks of infections, and the symptoms might have fever, severe abdominal pain, and convulsions and hypotension, like that symptoms. Next slide, please. Siddha, the traditional Siddha system of medicine, being the oldest ancient ways in which of maintaining a healthy life, and emphasizes the importance of physical, emotional, psychological, social well-being. The real strength of Siddha system relies on preventive and encouraging healthcare deliveries and management. Fundamental principle of this medicine successfully eliminates the evil side effects without losing the beneficial medicinal properties. Specific Siddha drug formulations exclusive for pediatric usage are given by Siddhas to combat childhood diseases and disorders. One among them is Uraimatri, composing 10 highly potential ingredients which has the greater ability to cure diseases. Next slide, please. Uraimatri, Urai means rubbing and Matri denotes its physical form. Uraimatri is a folk-class Siddha formulation employed as a immune pill for past 3 decades in hospital pharmacopoeia. The name itself denotes the mode of administration, given by rubbing and mixing with mother's milk and directly applying it to the baby's tongue. This immune pill has a major role in pediatric and childhood immune modulatory process. The drug helps improve the self-defense mechanism and boost the whole immunity. The clinical dose of these medicines is 50 mg and 100 from 50 mg to 100 mg. It will prevent recurrent respiratory infections and GIT problems and also anorexia. These drugs effects Uraimatri have hot potency and pungent taste. In post-digestion, it will convert into fire moiety, which in turn increases the IL of the body. IL in Siddha, it is responsible for the immunity as per Siddha construct. Vadamai padithu pitta vanniyai kathu serthuma seedamai todithu. Immunity is taken care with the increase of IL. Next slide, please. And these are the ingredients: Adimaduram, licorice, especially in first wave in Wuhan, Chinese doctors along with allopathy medicines, licorice was used widely to treat COVID-19 patients in China. Adimaduram is one of the wonderful drugs to treat COVID-19 all over the world in traditional medicines. It is one of the ingredients in Uraimatri also. Vernacular name Adimaduram licorice. It has antiviral property and anti-inflammatory property. Next slide, please. Next one is Agraharam, Anacyclis pyrethrum. It has also anti-convulsion property. Anti-convulsion property, it will prevent in missy. Convulsion is one of the symptoms. Agraharam is a drug which have anti-convulsion property, antidepressant property also. It will prevent anorexia also. Immune stimulant also. Next slide, please. Next one is Vasambu. In Tamil Nadu, it is called as Pillai Marundu or Per Solla Marundu. Acorus calamus, it is very famous in Tamil Nadu in South India, used widely from the day of birth of children in Tamil Nadu. It has the activities of anti-inflammatory, antibacterial, antispasmodic like that. Next one, please. Jadikai, Mystica fragrance. It has also antioxidant, anti-inflammatory, immunomodulator activities. Next slide, please. Kadukai, it is one of the superior drugs in our system, Siddha system of medicines. It is widely used in Tamil Nadu. Antioxidant, antidiarrheal, immunomodulator property is there. Next slide, please. Masikai Quercus infectoria. It is also has immunomodulator properties there. Anti-inflammatory properties there. Next slide, please. Pound garlic allium sativum. It is widely used in food in South India and especially in Tamil Nadu. Anti-allergic, anti-ulcer, antimicrobial, and it has also immune stimulant properties there. Next slide, please. Tipili Piperlongum. It has also anti-inflammatory property and immunomodulator is there. Next slide, please. Perungayum ferula axafoetida. Best digestive property is there. Anti-cancer, antioxidant, antispasmodic properties is the next slide, please. And chukku dry ginger, gingiber officinale. It has also anti-inflammatory, antipyretic, and antiviral activities there. Next slide, please. Yeah, that is conclusion. Uraimatri has been used from the time immemorial. It is in the form of long finger sized pellets dosage from 50 mg to 100 mg. It will prevent and cure recurrent respiratory infections, GI tract infections like that. It indicates that the ingredients of these drugs have potent and proven immunomodulatory, anti-inflammatory, anti-allergic and digestive properties. Its role in overall prophylactic and therapeutic action with regard to child health is noteworthy. Today's children are the future citizens of our nation. This polyherbal drug formulation shows importance in managing the forthcoming third wave of COVID-19 in children, promising to have a better nation with healthy citizens, good health status, growth and development at different stages of your life. Another studies shows it did not cause either mortality or any side effects on clinical signs or behavioral activities, biochemical, hormonal and histological changes, etc. One study shows the hypersensitivity reactions of immunomodulatory study suggest that the fourth hour reaction was found to be higher magnitude than the first hour reaction. It indicates that Urimatre has a greater effect on the delayed hypersensitivity reaction, that is immunomodulatory. With the emergence of newer infections and allergens day by day, treatment options are often short-lived and the need of finding out new drugs is need of the hour. Improve overall immune power of individuals, especially from the childhood itself, is a very important one. Urimatre, a very good immune booster, and Siddha immune pill. Next slide, please.
So that was the last one.
Okay, sir. Okay. Conclusion. Thank you, sir. Just one reference won't be that.
We seem to have lost the references.
Yes, sir.
Yeah.
No problem. We can put it somewhere in the link in the description. But thank you for this, because yes, the next wave is coming, and we have now a few immune system boosters presented throughout the week. Still, with each one, we try to tell everyone to first see a doctor, talk to someone who knows about this whole system and about your body, and then after that you can take these herbs or herbal formulations in a well done way, which will not harm your body. So thank you very much.
Thank you, sir. I take this opportunity to express heartfelt thanks to Knowledge Festival team, sir. Thank you very much, sir.
Thank you for you taking your time and putting in the work and the effort, just like all the people that helped this whole event come to fruition. So, Vinayak, who is the next presenter?
Dr. Soumya Om Prakash.
Yes, sir. Yes, sir. Yeah, I'm there, sir.
Oh, great. So then let's move ahead, jump in, and it's all yours.
Yes, sir. First of all, thanks for the team to provide for giving me this opportunity, and I'm very thankful to Dr. Vinayak sir, who has given me this opportunity at the last moment. So myself, I'm Dr. Soumya, and I am an assistant professor in the subject of anatomy, and I am from Maharashtra, Sangamner. Next slide, please. So my topic today is role of Manas Prakruti, or you can say personality traits, and Trigunatmak Ahara on mental health with special reference to Vyadik Shamatva or immunity. It means that we have to, Ayurveda actually is nothing but a more of a preventive measure. So when we talk, what I'm trying to say is, my topic is basically we have to first decide what is the prakriti or what is the nature of a person, and then accordingly we can advise that particular person with the kind of diet he or she should eat, and accordingly with the help of that particular diet he or she can fight against the diseases. Next slide, please. So there are three terms over here talking about Manas Prakriti. The word Manas is nothing but mind, but we are aware of these three terms, that is brain, mind, and mental, and we usually get confused between these three terms. So next slide, sir. Talking about the brain and the mind. The brain, it's a physical thing. We know it's a physical thing, and it acquires a physical space in a body, and it's the center of all the function. Whereas mind, it's not a physical thing, and it does not acquire any physical space. But most importantly, it creates emotion, enables consciousness, perception, thinking, judgment, and memory. In a short, it aids the brain. Next slide, sir. When we talk about the word mental, we don't have a specific definition for the word mental, but we can say that it is an ability of the brain to function without any problems or any disorders. Next slide, sir. Now, for example, if there are two patients with identical condition, and if they are given the exactly same medicine, but the effects are not similar, why is it so? Next slide, sir. The effect doesn't seem to be similar. The reason is most of the illnesses or the diseases are psychosomatic. Is the immune response towards the disease is dependent on both the psyche, that is the mind of the person, and the body of the person. That is why when we give exactly same medicine to two different persons, the effect is not similar, because some action of the immunity is dependent upon the mind of the person, the manas prakriti of that person. Next slide, sir. So in a nutshell, what we can conclude is that what causes each brain to become an individual here is though the composition or the physical composition of the brain is similar in every individual, it's the mind that helps in distinguishing people from each other. Next slide, sir. When we consider the word manas prakriti, I try to divide the word into mana, that is mana, or it is also known as mind or psyche, and prakriti differently. The word mana, or your mind, it's an internal organ of perception, and it is an instrument through which we can experience, and it is atomic, and it is eternal. We cannot see it. Next slide, sir. The second word is prakriti, which is nothing but a personality. In Ayurveda, in various texts, the prakriti has been defined by using various contexts. That is, for example, the first word is samya. Prakriti is nothing but samya, which is also known as equilibrium, or it is known as arogya, that is nothing but your health, or it is nothing but swabhav, or your nature, or in common general terms, it can be called as constitution of a particular individual. Next slide, sir. Now, they're talking about manas prakriti. Manas means mind and prakriti means personality. So, what are the different psychological constitutions, or what is the different personality or prakriti in Ayurveda? In Ayurveda, the prakriti has been divided into two types. Basically, it's the Dehik prakriti, that is also known as the physical constitution of an individual, and the other one is the manas, that is the psychological constitution of an individual. And both of these prakritis are genetically predetermined. Next slide, sir. There are two different terms. One is the personality, and then the second is a personality trait. These two words, we are very much aware of the word personality, but what is the personality trait? Now, when we talk about personality, it's a combination of qualities or characteristics that form an individual's distinctive character, whereas a personality trait is a single quality, a distinguishing quality or character that is typically belonging to that person itself. Next slide, sir. Now, what defines the psychological constitution of an individual? What thing can determine? So, Manas Prakriti, or the psychological constitution of an individual, can be determined by the predominance of the three gunas. So, what are the three gunas? So, next slide, sir. So these are the three gunas. It is present in every individual nowadays. And accordingly, if there is a dominance of sattva, raj, these are the three gunas, that is sattva, rajas, and tamas. These are three gunas or three qualities of the mind or the psychological constitution. And every individual's manas prakriti or psychological constitution can be decided on the predominance of these three qualities. If a person is having a sattva quality, predominance of sattva qualities or sattva guna, then that kind of a person is a sattvic person. If he or she has the rajasic gunas in her, then that kind of a person is a rajasic, and likewise the tamasic personality. These three gunas, when we talk about sattva, rajas, and tamas guna, the sattva guna is the most, you can say it's a very good quality amongst all the three gunas, because it brings about balance and harmony. Whereas rajas and tamas are not that good in qualities, because rajas guna has got the people who have more of rajas guna in themselves, they always are have some desires in their mind, and they always run after something. So that is a negative. It is considered as a negative energy. And tamas is considered the least, you can say, among all the three, because the people who have more of the tamas guna in them, they are very lazy and they have more tendency of suffering from depression and etc. mental disorders. Next slide, sir. So, talking about the psychological constitution or the manas prakriti of the body, what are the factors that influence these manas prakriti of an individual? So, these are the factors amongst which diet and environment is also. Diet is nothing but whatever we eat or our ahar, what we consume. Next slide, sir. Now in Ayurveda, there are three basic pillars of Ayurveda. Is first, it's the ahar, means what we consume. Second is nidra, that is your sleep. And third is brahmacharya. Brahmacharya means how emotionally or spiritually are you connected to yourself. That is the meaning of the word brahmacharya over here. So these are the three pillars, and among which ahar or food is also one of the most important pillar of Ayurveda. Next slide, sir. Now, talking about the three gunas and psychological constitution, this psychological constitution is, as I said, is hampered by whatever diet are we taking. And these three gunas are also hampered by what kind of diet we intake or what we eat. So there are there is an ahar or a diet that is known as Tri Gunatmak ahar or diet that also influence the psychological constitution of the body. And the reference of this Tri Gunatmak ahar has been given by Lord Krishna as an advice to Arjuna in Bhagavad Gita. What he says, Lord Krishna tells that the importance of food and the type of food we eat has a direct effect on our mind and soul, and the choice of food reflects our personality. Next slide, sir. Sir, next slide, please. Thank you. So the reference of the Tri Gunatmak ahara, that is in Srimad Bhagavad Gita, is in the chapter 17, with the verses of the chapter are 8, 9, and 10. Next slide, sir. So this is the diet which I have here you can see, which they are categorized as a Satwik ahar, the Rajas ahar, and the Tamas ahar. The Satwik food, which you can see in the picture, it's all which is very raw, which is fresh, and the Rajas ahar, it's more of an overcooked food or processed foods. And the Tamas, you can see the Tamas ahar is you can see the carbonated and freezed products, which you can see here. Next slide, sir. Talking about the Satwik food in the shlok that is given in Bhagavad Gita, they have defined it very clearly by saying that the food or the Satwik food, it's always in the form of juice. Means you should consume the food in its raw form and in the form of juice. And the Satwik food should always be mild, and it is always mild, and it's a bit oily in state, not much oilier, and it has got a very long lasting effect on our body, and it's also beneficial to the heart, stomach, and other organs as well. Next slide, sir. The benefits of Satwik food has also been given in the shlok. They say that the Satwik food has got an action that it increases the lifespan, that is Ayu. It is also brings about strength of the will. It gives physical strength, and it gives us freedom from disease. So here, when we see the two words, that is bala, that is nothing but the physical strength, and arogya, that is freedom from disease. These are synonyms to vyadik shamato, that is immunity. In short, Satwik food is very important when we talk in terms of immunity. It boosts. It's a kind of an immune booster. Next slide, sir. The Rajasic food, when we talk about the Rajasic food, they have defined it very clearly. They have said that any food which is very bitter, very sour, very salty, and very hot, very spicy, means we talk about all the junk, in general, we can see all the junk foods, they are all spicy and salty, and such kind of food are categorized under Rajasic foods. Next slide, sir. The ill effects of Rajasic food is they have given it very clearly that it causes suffering and lamentation and disease. And now the word suffering here doesn't refer that that he is sad or what, but it refers that while eating it causes pain to the tongue, throat, and other organs. Next slide, sir. The last one is the Tamasic food. The Tamasic food, they have said that these kind of foods are stale, they are tasteless, and they are putrid. They can be decayed or refused food, and these foods are unclean. Means in modern world, you see Tamasic food, whenever we see food which are in the form of frozen foods. Now Tamasic food, when we see the Tamasic food, food should be consumed within the 3 hours after it's cooked. But food which is being consumed after 3 hours, foods which are canned, they are either frozen, they should not be eaten because they are considered as Tamasic food. Next slide, sir. So these are in short some examples of Satwik, Rajasic, and Tamasic food, where you can see the Tamasic food has been specified as stale and cooked after 3 hours, and rotten meat or seafood, which includes foul liquor as well. Next slide, sir. This is a pyramid in which you can see the food has been categorized. Next slide, sir. So in short, intake of Satwik food as much as possible not only provides healthy body and mind, but it also is essential for the spiritual health as well, which has been defined by WHO. Next slide, sir. Now I come into some part of the modern aspect, that is Satwik food and tryptophan. Now majority of the Satwik food, that is more precisely I'm talking about the vegan or the vegetarian food, it provides a rich source of tryptophan, and it also protects the mucus lining of the gut. Now we'll see what is tryptophan. Next slide, sir. So what is tryptophan? It's an essential amino acid which cannot be produced by the human body, and it must be obtained through diet, primarily talking then plants or animal-based protein sources. It was firstly discovered in the early 1900s after it was isolated from casein, a protein found in milk. Next slide, sir. Now I have taken a reference of an article that was based on the effect of serotonin in the immune cells, and it was published by the you can say the Frontiers in Cardiovascular Medicine 2017 publication. Next slide, sir. So as I said, tryptophan is an essential amino acid that cannot be built up by the body itself. So it's a building block of serotonin. Now serotonin secretion in our body is very important, and how can the tryptophan be useful in the secretion of serotonin is whenever we are eating or consuming protein, which is a source of tryptophan, is not enough for our body to secrete serotonin. For that particular thing, it is responsible that eating carbohydrates with protein, it's a rich source of tryptophan, can increase the tryptophan to the brain, and it is then possible for tryptophan to cross the blood-brain barrier, which in turn synthesizes the serotonin, which plays a very key role in maintaining the immunity. Next slide, sir. So serotonin and immunity, we know serotonin, it's almost all immune cells express at least one serotonin component, and serotonin has got an immune regulatory effect derived from non-neuronal sources. It has shown to exert functions in innate and adaptive immunity as well. Next slide, sir. Now, Satwik food, when we talk about the Satwik food, it does not irritate the gut mucosa and maintains the release of peripheral serotonin. Now, there are some cells in the intestinal mucosa, that is enterochromaffin cells, that are residing along the epithelium lining of the digestive tract. And these cells are responsible for the secretion of peripheral serotonin, as also there are some gut microbes that help in the release of serotonin, and that is about 80% of serotonin. And if in any case we are consuming the type of ahar that is tamasic or rajasic ahar, it will somehow irritate the lining of the intestinal mucosa, which will lead to the decrease in the secretion of the serotonin or decrease in these microbes. Next slide, sir. So this is the last slide of mine, in which you can see this picture. It shows that in the chariot of body, this whole picture is depicting our body. In this picture, the chariot is the body, which has 5 horses. The 5 horses here are representing our senses, that is our tongue, eyes, ears, nose, skin. Then the rein here, the driving instrument, is our mind. And the driver is the intelligence, and the passenger is ourself, that is us. So what they have said is the manager should use their intelligence to control the mind, and then should not let the mind to be controlled by the senses. In short, is what I want to say, that as much as we can control our mind and try to consume more of Satwik food, it will indirectly affect our mental health, which will eventually help in maintaining our immunity or immune system. Thank you, sir.
Thank you so much. This was very structured, comprehensive, and looking at this issue of Satwik, Rajasic, and Tamasic food and diet and lifestyle from really many different sides. Just before we move on, one question, I don't know if I heard it right, but you said there was a WHO protocol for spiritual, I don't know, well-being?
No, sir. I was trying to say that in the definition of as WHO has defined the health, the definition of health, right. They have also mentioned about the spiritual health.
All right, I understand.
Yeah, I was trying to say it that way.
No, I was not sure. Maybe there is a whole spiritual guideline by the WHO too.
No,
I mean,
in the definition of health, they have mentioned about the spiritual health. Yes.
No, that's understandable. Thank you very much for your time and your work.
Thank you so much, sir.
And we will move on to Vinayak.
I think Dr. Kamala Soundaryam.
Sir, I am audible.
Yeah, Wes, you will have to give her the co-host. She will
right.
host the slides.
Sure. Here we go.
Shall I start, sir?
Yes, you can start.
You can share the slides also. Yeah.
Is it visible, sir?
Yes, great. Just.
Good evening to all, sir. And I'm Dr. Kamala Sundaram, Program Assistant, Pharmacovigilance, Siddha Central Research Institute, Chennai. From the last days of this knowledge festival, we enrich our knowledge about the immune system, immune disorders and disease, and immune boosting medicine, yoga, diet, etc. Whenever we talk about the medicine, we have to be too vigilant. So I choose this topic, pharmacovigilance view of immunosuppressive herbal drugs used in the Siddha system of medicine. The next introduction. In this introduction part, I just give the synopsis for this presentation. So first, the immune system plays an essential and a significant role in the protecting the body against pathogens. Autoimmune disease are caused due to the imbalance in the immune system. Immunosuppressive herbs in the Siddha system of medicines are more effective in the treatment of the autoimmune disorders. So the physicians are used these herbs widely for the successful practice. For the purpose of that, yes.
Your microphone is possibly somewhere. There is some scratching noise or something. Just everything else is fine. It's just a little noise on it. Just
for the purpose of drug safety, is it right now how it is, sir?
I'm not sure. Maybe it's a little better, because maybe it's also not scratch. It's just the breath. Maybe it's just too sensitive, the microphone. But we'll find out. It was a little better. So just don't worry. I mean, it's not too bad anyway.
Shall I continue, sir?
Yes, go ahead, please.
Yes. For the purpose of drug safety, this presentation explains the ADR caused by the immunosuppressive herbs in the Siddha medicine. Immunity refers to the relative state of resistance of the host to the infectious agents. Immunity protects against the infectious disease. Immunity distinguishes the self from non-self. This is the main core of this topic. So I highlight this. And immunity eliminates the potentially destructive foreign substances from the body. I just describe about the autoimmune disorder. An autoimmune disease is a condition in which our immune system mistakenly attacks our body. Normally, the immune system can identify the difference between the foreign cells and our own cells. But in autoimmune disorder, the immune system does not distinguish between the healthy tissue and potentially harmful antigens. As a result, the body releases the protein called autoantibodies that destroys the normal tissues. Some autoimmune diseases target only one organ. Example, type 1 diabetes, it targets the pancreas only. But some autoimmune diseases target the whole body. Example, systemic lupus erythematosus. Immunosuppressive effect of herbal medicine. The capacity of a herbal medicine to inhibit cellular and humoral immune responses can have useful application in some immune-mediated disorders, including autoimmune diseases. Both activation of a T and B lymphocytes and macrophages and defective apoptosis of immune effector cells play critical roles in the pathogenesis of this disorder. Just give the autoimmune diseases. More than 80 common autoimmune diseases are identified. Among 80, the 14 is more common autoimmune diseases. In this, type 1 diabetes and rheumatoid arthritis, psoriasis and psoriatic arthritis, multiple sclerosis and systemic lupus erythematosus, and inflammatory bowel disease and pernicious anemia. These are all the diseases are frequently treated with the herbal medicine. So I just highlight these things. Then the common single herbs used to treat the autoimmune disorder. So these are all the common single herbs used to treat the autoimmune disorders. That's Withania somnifera, Canephora cardifolia, Curcuma longa, Glycyrrhiza glabra, Zingiber officinale, Andrographis paniclata, Allium sativa, and Camellia sinensis. Camellia sinensis is green tea, which is not in the Siddha system of medicine, but it is widely used for the autoimmune disorder, so I quote it here. So these are all the immunosuppressive action which is given for the reference. First, Withania somnifera, the chemical constituent present in the ashwagandha, that is Withania somnifera or alkaloids, steroids, saponins and methanolides. These constituents produce a immunosuppressive action on B and T cell activity in hyperimmune status. And Glycyrrhiza glabra, glycyrrhizin and glycyrrhinic acid are the active constituents which have the immunosuppressive action. So glycyrrhizin lead to a reduction of TLR4 expression in the heart and lung cells. This was accompanied by the significant reduction of cytokine release. That is the release of TNF alpha and interleukin 6 and interleukin 1 beta. And then Tinospora cordifolia. The immunomodulator property of the Tinospora cordifolia extract was validated by assessing its effect on activating resting macrophages and by estimating the generation of secretory factors like nitrous and lysosomes. And curcuma longa, curcumin has been shown to be active on lymphocytes and affects a series of immunological functions, including antigen presentation, humoral and cell-mediated immunity, and cytokine production. Then, gingiber officinal, the 8-gingerol is one of the principal components of ginger. This could suppress humoral and cellular immune response in mice. The mechanism might be related to direct inhibition of sensitized T and B lymphocytes. Andrographis paniculata, it has the inhibitory effect on NF-kappa B transactivation activity and also inhibit the nitric oxide and prostaglandin A2. Allium sativum, garlic has shown to reduce the pro-inflammatory cytokines, interleukins, TNF alpha and interleukins 8 and stimulate the interleukin 10 secretion. Interleukin 10 is an antagonist of the pro-inflammatory cytokines and therefore this effect may be potential mechanism justifying the garlic's use in the inflammatory diseases. The Camellia sinensis, that's a green tea. The epigallocatechin 3 gallate, a component of a green tea with the anti-inflammatory and immunomodulatory activities. This compound has shown the inhibitory effects on human monocyte derived disease and consequently on the T cell mediated immune responses. Shall now I explain about the immunity and autoimmune disorders and the herbs used in the autoimmune disorders to suppress the immunity for the better results. So I just moved to the core of this presentation, the pharmacovigilance. The pharmacovigilance is the science and activities relating to the detection, assessment, understanding and prevention of the adverse effect or any other medicine, vaccine related problems. In Siddha, the adverse reaction is explained as a Kallapini in Kannasamy Pillai Varthuva Bodam and Kannasamy and Vaidhyasara Sankritam. The Kallapini is the synonyms for the adverse drug reaction. It describes the drugs, cures the indicated disease, but subsequently cause the other illness too. That's known as Kallapini. This drug should not be considered as a medicine. As per this Siddha literature, wherever the drug causes the illness to the patient, this drug should not be considered as the medicine. So what could be the medicine? It is expressed by Tirukural. This is an ancient Tamil literature. In this literature, Marundu is in Marundu Adhigaram, Utravan Tirpan Marunduri Silvan என்று அப்பால் நாற்குற்றே மருந்து. The medicine is not only the chemical compound, this is a component of the responsibility of a patient, doctor, and medicine, that's a manufacturer and the pharmacist. I just explained why, because whenever we have a lack of knowledge or lack of practice, a better practice in the patient or doctor or manufacturer or pharmacist, we lead to the ADR. So the occurrence of the ADRs are due to the doctors or by patients or by the medicines, that is manufacturer or dispensing pharmacist. So how it is occurs? Error in diagnosis, error in selection of the drug, error in combination of the drug that may lead to the drug interaction, and diet advice, and duration of the treatment. The chronic duration may lead to the cumulative effect of the drugs and come to the patient, ignore the doctor's advice, and error in the medicine dosage, and error in the vehicle, misuse of the drug. It may be a route of administration too, and duration of the medicine. And come to the pharmacy side, error in medicine preparation. Whenever we did the error in medicine preparation, it may lead to the ADR, and error in dispensing the medicine. These are all the causes for the ADRs. Then, why people choose a herbal medicine? Because people always choose a herbal medicine. They always believe natural is always safe. A herbal medicine are cost effective than modern medicine. Herbal medicine can be brought without a prescription. People believe herbal medicine do not have any side effect as they are free from chemicals. So their belief is not true always. No medicine is absolutely safe for all the people in all the places at all the time. So there is a monitoring center for the medicine. That's Uppsala Monitoring Center, which is a WHO collaborating center for the international drug monitoring. Still now, we are so many areas are reported here. I just give the examples for this presentation. I just deliver the 8 plants, so which is reported areas. So Withania somnifera, number of areas 42, Tinospora cordifolia 36, and Curcuma longa 162, and Glycyrrhiza glabra 172, and more areas are reported to the Andrographis paniculata, and the Zingiber officinale is one of the common plant we are using. That's also reporting 237. This is a worldwide report. I just this is a VG axis. So I get from this database of the VG base. So when we search the plant name, I just put the Andrographis paniculata. There is 329 areas are reported still now. So they give the adverse drug reaction by system organ classification. Likewise, blood and lymphatic systems, cardiac system, ear, eye disorders, and gastrointestinal disorder. For Andrographis paniculata, the gastrointestinal disorders, I choose it. For this, the vomiting is more, and then nausea, diarrhea is also here. So next, they also give the geographical distribution, and then the age distribution. The common age group having the areas for the Andrographis paniculata is 18 to 44 years, and the patient sex distribution is a female or more prone for the ADR for the Andrographis paniculata. This is the year. I just skip to this. So submission to this forum, kindly report ADR regarding the herbal medicine. Herbal medicine is also the medicine. So this is safe to the people. I need to register this. We have to report ADR. It is a major tool to standardize and globalize our traditional system of medicine. So patient safety is more than anything, more than science. And thank you all. Take and tell together for a safer medicine. I thank for giving me the opportunity to this knowledge festival organizing team. I need to register my thanks to my coordinator, Dr. M. Kannan, and for his great support and guidance. And I extend my thanks to Director in charge and to DG Ma'am CCRS. Thank you all.
Thank you very much. This was a great presentation. Also, as our final presentation, right, today, and for the festival, bringing up the ADR and also this element that might be a part of whatever guideline we would have to get to at some point if we want all around worldwide, all systems kind of protocol to do studies and research. We need, yes, all kind of elements to see what really works and what maybe has issues, and all these errors should be dealt with separately. Thank you so much for your time and the work you put in, and thanks to all the presenters today and throughout the week. We had our final presentation of the first Knowledge Festival.
Yes, I think we have two questions actually, maybe for Dr. Kamala Soundariam. I think whether is VG access freely accessible to all? So the.
Oh, okay.
And also, Dr. Arul asked one question: whether many ADR reports have been entered from Indian Ayush community.
So, Doctor, would you please give us a short insight on that?
Dr. Kamala, I think the question is to you.
I think her audio sort of broke down. Let me see.
Maybe we will try to answer that during the discussion time. So.
No, it's like she lost her connection for a minute. So once she comes back, maybe. Okay, now to the final discussion round. Would you, Vinay, tell us who is part of the discussion?
I think Dr. Arul is already here. Dr. Piyush Juneja, I think he's also here. Namaste, sir.
Yes, great.
And Dr. Mini Mehta from Homeopathy, she also is joining us today. We have some good practitioners to actually discuss some really important issue. And also Dr. Sri Hari Sukesh from Yoga. Doctor, are you here?
Welcome. Yes, I can see him.
Namaste.
Welcome.
Great. So, all right, we are set. I just no.
Dr. Mini, she is here.
Oh, but Dr. Kamala is.
Yes, sir.
Possibly, yes. Would you be so kind and give us a short answer to these two questions? Did you hear them, or should we repeat it?
Chat box. Yeah.
It's also in the chat box. So that the one question was, are many ADR reports being entered from Indian Ayush community?
So still now we don't know about the areas reported from the Ayush community, sir.
Oh, okay. So that one we did. Yes.
It's in the streamline.
Right.
So I get it from the Vigi base through the Vigi access, sir. We don't have a data from the Ministry of Ayush or Ayush Medicine, sir. It's a single herb only. I just shared this.
And is Vigi access freely accessible to everyone?
Yes, sir. Freely accessible.
All right. So thank you very much. Thank you.
Okay.
Great work. Now we go on to the discussion. Let's see. Welcome to everyone. It's great to have these experts on board to go through maybe 2-3 questions. I will put out the question and go from one to the next, and please give us your thoughts. Take as much time as you need for it. We had this week where we saw different systems of medicine that might not be taken into account on a global basis, and may have to fight for their place to be acknowledged. So, which challenges do you face as far as acceptance of the Indian medicine systems among general public? Let's start with Dr. Arula Muta.
Okay, Vanakkam, Namaskaram, and good evening to all. I thank the Knowledge Festival organizers, Dr. Faisal Naziri and Dr. Vinayak Nayak, to organizing this and inviting us for sharing their knowledge from different medical systems. And I thank all the participants also for sharing good experiences and concepts. So regarding this question, I feel in India or even worldwide, while observing the last all the sessions, what I understood is the concept of immunity and the genesis and the maintenance of the immunity and its treatment approach in all the traditional medical systems are almost having 90% similarities. But there are some uniqueness in each system in the therapy wise or some lifestyle advising, and it is in different terminologies. So what I feel is actually there is a need for the integration of all the traditional systems all over the world, and we can have a common syllabus or common understanding. Like I think this is the first attempt you have done. So it will facilitate the understanding and acceptance of traditional system. So in India, in same street, one person will practice Ayurveda, next Siddha doctor, Homeopathy, Unani, and all will give Three Gadaga, Three Phala. So in different names. So, but 80-90% similarities are there. So such a overlap could be, overcome by having an integrated first traditional medicine system among themselves, so that the common people will get a good idea and same kind of consistent the concept without failing the compromising our own traditional also. So that way it will facilitate the usage among the public. So that is the one point I want to note down. Another thing is when we talk about the traditional system, we talk about holistic. So which means in with respect to the immunity, we don't see any immunodeficiency or any such a diagnostic parameters in our systems. So we see everything as a holistic, mean as a wholesome, whether the person is suffering as a whole or he is having a good well-being. So that is what taken into account to as a immunity. But when come to the modern medicine, I am a pharmacologist too and working in modern medical college. So when we do research, we don't see as a whole well-being. We just see T cell, B cell, or what about the neutrophil and some markers, proteins. So that is what we try to understand. So modern science tries to understand the physiology or mechanism. So everything it tries to understand. But the traditional systems already reached the level of treating it already in the practice. So it's a time actually to integrate both the traditional and modern sciences so that what we practice is actually effective. There is no doubt, but there is a lack of explanation in the scientific side. For example, a person underwent renal transplantation, and later if he develops some immunity related issues, if he comes and asks us, can I take Tulsi, can I take Euthenia somnifera, can I take the Tinospora cardifolia, because they are all good immune boosting herbals as per our terminology. So naturally there will be any conflict or we don't have answer whether because renal transplantation patient already under some immunosuppression therapy, if you boost immunity, whether it will reject kidney, because that is the question. We don't have answer for that, but I don't think it will reject. But still, theoretically or scientifically, when we discuss, we need some scientific evidence. So such a studies should be carried out among the public. Even this is not the question from the scientific community. Even people and publics are now well educated. So it's not underestimating the patient. Patients themselves have such a question. So when they ask a question in that language, our answer should be in that language. Instead of that, we just tell them it will balance Tridosha or it will balance Vata Pitta Kapha. We try to tell our explanation that may not be convincing to that patient. Even in the COVID situation also, the concept was that we have seen that the theory says hyperimmunity, there is a hyper responsiveness against the virus that leads to the hyperimmunity status, and more some of the inflammatory markers are produced that leads to lung fibrosis and vascular injury. So here, ideally, as a scientific person, I think if you raise immunity, you are going to put the COVID infected patient in a dangerous situation, because we are now favoring the immunological reaction. So now what is our answer? As a traditional medicine practitioner or doctor, we should have some kind of dialogue with the modern interdisciplinary doctors or basic medical scientists to find the answer. So the my first query what I want to keep is put in the forum is addressing public queries in the scientific way. So that is actually lacking in Indian scenario. So I will finish with this point now. Later points I will discuss later. Thank you.
Thank you very much. So basically you are saying let's bring together all these systems with all their similarities and work in some details, and also maybe the language, that the way to communicate with the patients and with the world outside maybe can be kind of changed a bit to fit in a modern world. So maybe important points to bring people more together. But yes, thank you for that. Dr. Piyush, maybe you can give us your idea on what's the challenge in bringing all these ancient technologies into the modern world.
Yeah, thank you. Thank you so much, Dr. Vesal Nesri and Dr. Vinayak Nair. And I thanks to all the panelists here today for joining and supporting this event. And an excellent paper presentation was going on. I've just seen a couple of presentations. So very much we are motivated, and it's good to see that younger generation is coming in with that much of energy and that much of knowledge. I belong to clinical research pharmacovigilance, and I worked with companies like GlaxoSmithKline and Max Group in past. And pharmacovigilance at that time in late 2000 started in Indian allopathy. Now I was very much happy to see today. Sorry, I missed the name of the presenter, but I think she was talking about pharmacovigilance in Ayurveda. So that is very encouraging and very, in fact, essential. Now coming back to the topic of challenges, see, personally what I feel is, first, I agree to some extent with the thoughts Dr. Amtham is having. But on the same note, we also need to understand, see, each pathy is having their own differentiating factors in terms of physiology, pathology, or if we try to figure out the mechanism. Sometimes we are not able to analyze or scrutinize the entire concepts of, see, I belong to Ayurveda. So first of all, as per my introduction, I'm an Ayurveda consultant working, like my practice is based in Delhi NCR. And from last few years, focused on clinical practice of Ayurveda as I started my journey in corporates. And also we have started platform indianvadyas.com. Right now we have more than lakh of doctors associated with us across India. And around 20 cities, this site is on first page of Google as well, if somebody is searching Ayurveda doctor. So the challenges broadly are few. There are 2-3 perspectives of seeing these challenges. I will come to the perspective of patient first, and maybe later on we can add on to other perspectives as well. Now, if you talk about patients, ultimately everybody and every patient wants to get healed. It doesn't matter to them whether which mechanism it is working on. There can be some side effects of chemical herbs, chemical medicines or herbal medicines. They are fine. Ultimately, end of the day, everybody wants to get healed. And second thing in this is we need to understand, we can replace or we can match apple to apple. Now the problem here is, for example, I will share some typical examples. So there is one patient who is coming to us for hyperacidity, and he's used to or she is used to take one pill in morning, and this is suppressed. It's not getting healed, but it is suppressed, and they are fine. But they want to heal that. Now, if I gave them lots of medicines, or maybe 2, 3, 4 medicines, some churnam, some kashayam, I respect classical medicines, but sometimes it's not possible for them, and we need to replace and we need to transform the new age Ayurveda. It can be classical, but in the form of, say, for example, tablet, capsule, or any other. If it is churna also, let replace 1 or 2 medicines with 1 or 2 medicines. The challenge is sometimes we have seen that many Indian system of medicine practitioners, they are giving 5, 6, or sometimes 10 medicines with the replacement of one they were taking. So that is one challenge which basically any patient will not be able to handle. And we all are in corporate life, we all are in professional life, we are busy with our personal and professional life. So they want to replace whatever they are taking. In fact, many of them are coming for the first line of treatment now. Gradually, after this pandemic and epidemic, many people have realized, and they are coming us. Earlier they were used to roam around to other pathies, and finally when they when they've exhausted all the other pathies, they came to Ayurveda or Siddha or like that. So now they are coming up for the first line of treatment. Somebody has been recently diagnosed with diabetes, and they are coming to us, okay, if Ayurveda can help and I don't want to take chemical medicines and something like that. But they need specific, the compliance should be at ease for them. It's not, they get tensed by seeing so many medicines. Okay, you have to take this before meal, this after meal, you have to make a kashai, you have to mix it with something. All these things are, especially in metropolitan cities, sometimes it's a bit challenging. So again, as I said, I respect the classical one, which is absolutely fine. And to some extent, it has to be administered. But sometimes we need to also understand the other person ease and the compliance which he or she can follow. That is point number 1. Second is, see, again, the efficacy and the claim should be realistic. It's not unrealistic. So with due respect to every system, we have the limitations. And if we have the limitations, we also need to understand that to that extent we can claim. So if we can heal something, we can say that yes, we can heal. But if we are not able to heal, let's admit that, and let's set our limitations also. Sometimes I have seen like Indian system medicine practitioners, we are claiming irrational, and we are like, for example, in this COVID times. So everybody was like after, okay, we have also managed certain patients, and to some extent, many medicines are very effective as well. But again, without doing the, as correctly mentioned by Dr. Arun, without doing the valid research, and again, it's not about scientific parameters. You can do research with Ayurveda principles as well. It is fine. You can have your own protocols on the basis of Ayurveda principles, but research should be there and validation should be there of that claims. It's not hypothetically somebody is saying, okay, we can treat this, or maybe we have seen results in 1 or 2. In fact, if you see the entire journey of any medicine, after treating thousands of patients, sometimes it will get failed. And in Ayurveda, although that is not the concept, but still to some extent, we have to understand that. And very important aspect to the entire scenario is, in Ayurveda or any Indian system of medicine, it's not that a single pill can heal all the patients. So it has to be an individualistic approach. It has to be a specific approach that, okay, for this particular patient, this set of medicines will be working. We need to see Vatpit curve, we need to see Dincharya, Ritucharya, we need to see Sandhi Kal, and which dosh is Prakop, which is like at what stage, Nadi Pariksha, many things are there. So it has to be a bit individual approach, a bit specific approach, rather than actually the business model is like that many companies are just promoting that, okay, this pill can heal everyone for a particular disease or a particular element. So that is also again not fine as far as these systems are concerned, because we have been beautifully designed, our acharyas and rishis have beautifully designed this concept. So we need to practice accordingly, and we need to respect those concepts. So I think if we focus on that and minimum specific treatments, I repeat, is very much in millennial. We talk about millennial Ayurveda, we talk about new age Ayurveda, we want so many youngsters are coming, like we specifically treat so many gynae disorders. So young teenage girls are coming for PCOD and all, but they need specific and to the point treatment, and a treatment which easily they can take. But we have seen that as yes, if they are, and by the way, first and foremost is the confidence. So on one side, we are talking to avoid irrational claim. On the other side, there has to be some kind of a confidence, which I have seen is a bit lacking in some practitioners. So they know that Ayurveda will work, but the confidence that, okay, maybe with experience it will come, but that has the patient is looking for you and they are keep on asking and keep on poking. So we always say that yes, it will be better, it will be healed, but at least with confidence, without claiming or stating any kind of a guarantee, which is definitely not there in any medical science, be it allopathy or Ayurveda or whatever. Still, we are doing our best. So in those scenarios, if we practice and focus, society is gradually accepting. Society is in fact looking forward for getting better solutions for their health. They have now understood very well that yes, if we follow, and the final most important part is, this is the system with holistic approach. So it's not if you're taking some kind of a pill or capsule, but you're not managing your diet well and you're not managing your lifestyle well, it will help you. No. So that also we need to understand and we need to convey. Like for example, when we do a prescription, so on the back side of prescription, we give them all the dietary and lifestyle guidelines and tips to follow, what to do, what not to do, which food they have to take, which food they have to avoid, and so on. So all these descriptions should be there, which many times they come up and say, okay, my so-and-so doctor has not recommended me, why you are giving that, why you are saying that. So see, we need to again understand that in our system, the entire concepts are mentioned beautifully, and it is the aim or the objective of Ayurveda, if you see, is swasthasya swasthya rakshanam aturasya vikar prashmanam cha, means we are protecting the health of an healthy individual, and after that we are treating the person who is having the disease. So the first mindset and the first aim is to uplift or to prevent or to maybe regain, enhance the health of an healthy individual. Swasthasya swasthya rakshanam. Now in that concept, it is clearly mentioned that these are the various aspects and fundamentals of diet and lifestyle. Dincharya, ritucharya, whatever seasonal fruits, vegetables we have to take, we have to avoid that. And all that is beautifully mentioned. About lifestyle, it is beautifully mentioned. What time you have to get up, at what time you have to take your meals, what time you have to go to bed. And all these things are beautifully mentioned in our literature, in our science, in our textbooks. But problem is, due to again this modern lifestyle, we all know that yes, this is not good for it, but still we are following. Now we have to figure out a middle way. It's not like somebody is working in a US shift in India or a UK shift, and we say, okay, aapko Brahm Muhurta mein hi, like you have to get up. It's not possible. They are going to bed in Brahm Muhurta. So that is not possible here. So the point is, we need to understand, and accordingly we need to convey them, and we need to maybe modulate their diet and lifestyle so that their prakriti will not affect much, because prakriti getting affected or getting imbalance will yield to vikriti. So that is the basic fundamental of Ayurveda. So in that scenario, if we counsel them, I have seen so many patients, 50% of their issues will be gone if we have guided them with the correct diet and correct lifestyle, which is very, very important. And many times, many busy clinicians maybe sometime is missing. So these are some things which we have seen. If we have inculcated and infused in our patients, they are very much proactively following that. And many times after a few months, say 3-4 months, when their problems are significantly decreased or almost gone, they are still following the lifestyle and diet, which is helping them out in getting to the complete healing with a minimum medicine administration, which all of us want. So that is again the ideology. We don't want to get them depend on, but yes, if there is some disease where they have to take lifelong medicines, be it Ayurveda or Herbal as well, they have to take it. But the idea is to again adopt and to make some flexibility in the system to them so that they can infuse that in their life, and accordingly they can take it forward. So in these aspects, if we can understand, and the mindset of the patient, if we can understand, the more and more, like we have started with one member of the family, when gradually we have seen, and within last, I think 3-4 years, we are right now one of the highest rated Ayurveda clinic in entire North India. So that's why I think it's a very small clinic at a very small setup. But I think these fundamentals and these small things we have learned in our journey, which we are imparting, and also now we are promoting through our platform to other fellow doctors as well. So that can be one thing which we need to understand, and accordingly we need to take it forward.
Great. I think, Vinayak, we need to take notes, because everyone is coming up with real stuff. So we had to from Dr. Arul to bring the systems close to each other, so that there is not all these different names and different attitudes without there being anything different about the systems, and to communicate it differently. Now we have this kind of that this Ayurveda or Siddha or Unani, they should take their own place in the whole universe of healing or of health as a complex entity. And also, what I can remember with Dr. Piyush at the pre-talk, he was putting a huge emphasis on standards, of highest standards with the ingredients of Ayurvedic medicine, and of the kind of build-up of the places and the procedures of all these medicine and medical tools, and everything should be standardized in a way that we can have a reliable basis to move on. So now we can see things can be communicated in a way, and also just to give a recap, that Ayurveda can have a certain place, for example, and modern medicine has its own place, and also they can go side by side and just support each other. But as we had before, we have to go through studies to find out, is it really working? Can we just give someone that Ayurvedic medicine as an extra, or will it destroy the function of the other method, or will be anything else but helpful? So thank you very much. Let's move on to Dr. Mini Mehta. Let us know what kind of ideas you have, how to overcome the challenges in being understood in the right way, and being taken into the universe of medical treatment and health.
Everyone, I was listening to the conversation, and actually he has said everything, almost everything. But the challenge is that the people around the world, they are misguided in a way that all the traditional medicine are very slow in working.
We have an echo of sound, doctor. We don't hear you so well.
Okay. Wait a second. The biggest challenge is that people around the globe, they think that all the traditional medicines like Ayurvedic medicine, homeopathic medicines, they are very slow to act. And they want something fast to work, because they want to carry on with their lifestyle, and they don't want to have to learn that they should not eat this, or they should wake up at this time, or they should live like this, think like this, pray, or whatever. People don't want any guidance. Nowadays, the generation is like they hate guidance. So they have love for a doctor who has more of attitude. He'll charge high and has an attitude to ask only 2 questions, prescribe lot of investigations, which a patient can analyze on his own to know that what is the problem with him. And they need to have a control over the medicine and everything. All the patients, they want to have a control. They don't want to be answerable to any physician. Whereas if they are going to some traditional medicine person, he's going to ask, what did you eat? How are you living? What are you doing? I'm sure you must have done this. Oh my God, why do you want to know this much? So this is the biggest challenge. People are like this. Like I will tell you, no doubt in emergency conditions, when there is an accident, somebody has got a fall or a brain injury, definitely he should have a decompressive surgery. He needs all the modern medicine treatment without any delay. Yes, later on our role comes when we have to give some hemangioma medicine or hemorrhagic medicine. We have a lot of herbal medicines which are wonderful in solving that, in healing. But right at that time, modern medicine is good at that. So, but when we come to the cure of the chronic diseases, the biggest challenge is that we have to make people believe in everything, our knowledge. Like if we tell them like they have a body that they should not eat pungent things or sour things, that this is not good for them, they should be able to take it. Because most of the people who land up with traditional medicine person like Ayurveda or homeopathic person, they only come to us when following a lot of conventional medicines, they start suffering loss of function. Like if somebody was having recurrent throat conditions, burning in throat due to acidity or the general condition or the lifestyle, but he was taking what he was taking, modern medicine things he was taking. But now when he has suffered total loss of voice, aphonia, which is not having any pathology, which is not having anything, now he wants to try traditional medicine. Now this person will come and will listen to you everything and will follow, and then he then also he won't bargain for the time, because he has enough time, because he has got loss of function and he's not able to perform what he wanted to. Otherwise, people think that if they will keep on taking our medicines, or they have to see doctor number of times, so they feel that they are recovering very slow. Whereas in other systems they can recover very fast. And here they know that every time if they have to take a medicine every week or every month, they have to see the doctor. Whereas if they go to any allopathic doctor or conventional modern medicine doctor, they write a prescription and tell them, like for thyroid, if they go to some conventional medicine doctor, he will write a prescription which is forever life. But if we will treat, okay, do you feel trembling in your hands? Okay, what time you sweat? When do you feel like that? We will try to make out in a classical way of medicine most suitable for the person. And next time we want to reanalyze till the time the patient is, restored to health. But patient never realize what is health. So health education is also very important part. If people are aware what is actual health, then they will be able to, follow the traditional system of medicine in a more, more accepting way. So this is a challenge what I feel. Like, yesterday only I had a patient, she had severe pain in her abdomen, and I told her, I gave her medicine, she was 60% relieved. But she said, I am having pain. People don't realize what is normal pain, what is severe pain, what is a mild pain. They don't know when to wait. They immediately are running for painkiller. Then we got her ultrasonography done. We got to know there was inflammation in the liver. There was gallbladder stones. There were bilateral kidney stones. There was a fibroid in uterus. But what she feels that if she'll take a painkiller, she is getting cured faster in that way. So we require a lot of teaching and guidance, which people refrain. So I think this is a challenge we face when we, start treating. We only are able to treat people who traditionally follow our treatment, or who are, sent back from the conventional medicine that nothing more can be done for you. Or when they start, experiencing that side effects or loss of function or no hope, or they are, afraid of surgeries. They don't want the hysterectomy done. So that time how many times they will get their kidney stones out through surgery. So then they are forced to follow us. Then they are ready to do everything. So this is, I think, this is the challenge we we all face. Right.
Oh, thank you very much. So further going on, also the previous idea that each system should take their place in the universe of health. Of course, as we also mentioned before, once you have a bad accident or something really urgent happening, then you will need the modern medicine. But then to prevent anything, to keep your body healthy, to get back in shape, etc., you could use all the extra effects, and also possibly, as we had also with Dr. Piyush Juneja at the pre-talk, you can set up situations where the traditional medical systems help and support situations with the modern medicine, with ICUs, with wherever you want to have that. I mean, it can always be part of the whole system, and finding that place, and finding the cooperation, the willingness to cooperate is the most thing. And you also mentioned the need for speed, as it is, that people want things to happen very quickly, and sometimes you need to change your lifestyle. This might take weeks, months, or maybe even years for something to change. So, but then it's a real thing, and we all know what this is about. But people want more of a faster move. So we can find ways to combine that and to make that in different steps. So now coming to Dr. Shri Harisukesha. Welcome. Maybe you can give us your point of view on the challenges to bring these. I mean, yoga actually is the best component here when it comes to integration into the modern world, because nowadays yoga is really something, I mean, maybe not the real yoga, maybe more an image of yoga now, but still it's a lot. People are doing yoga, people are accepting it as something very much working. So we could use yoga as a first step, as a ladder to a higher acceptance and a higher possibility. What's your idea? What are the challenges? What can we do? What should be done to get these systems into play?
Okay, thank you very much, Sri Vinayak Nair, Dr. Vinayak Nair sir, and Vasal Nasari. And good evening, all the members in the panel. Am I audible?
Yes, absolutely.
Yes, thank you. So, like, I'm absolutely agree with your point of view that yoga, it is one of the practice which we can integrate with all the other, even the traditional medicines like Ayurveda, Siddha, and as well as the modern medicine. So we know that in earlier that there was not much concept about like what we can say. If we have a problem, then immediately we have to take a medicine so that the disease will be cured. But later, slowly the concepts it is developed, that is, not only medicines are consuming medicine will not helpful to cure the diseases. even like modern medicine. Only medicine will not help, so that we have to modify the lifestyle also. In our traditional medicines like Ayurveda, Siddha, etc., like more giving importance to changes in the lifestyle medicine like Pathya and other activities, etc. But what we can say, there was not appreciated much in those days by the majority of the people. But nowadays it is slowly, the awareness is coming up. So most of the people, they are also agreeing that only consuming the medicine is not the solution. So there is something more. So here the uniqueness of the yoga, yoga is not like a medicine, like other medical intervention. We cannot apply yoga as other medical interventions. But the way how yoga is working, that in the principle that our body has our own system. There is a tendency, natural tendency to restore the homeostasis. So if something is happening, so we should provide like supporting atmosphere so that body can itself restore the systems. That is most important. That awareness is lacking in the people nowadays. So we have to bring that awareness in the common people. That is one of the challenge what we are facing nowadays. Anyway, but when we are applying yoga, there are so many challenges we have to face when we are integrating. Like in modern medicine, when these modern hospitals, they are not that much keen to integrate. Not everybody, but many doctors and hospitals, when the patients the patients are telling the doctor that they are practicing yoga, then immediately they will there was such a kind of incidents that they will make afraid of them, that don't do such kind of practices, or it will create problems. Such kind of things are there. But instead of that, what we can say, if they can that the medical system also, particularly in India, if the medical system also integrating, they ready to accept the integration, the importance of integration, if they are ready to accept, then it will be a wonderful combination. So like in the last presentation, I forgot the name, but the presenter told, like medicine is like not like a medical property. It is like a combination of doctor, patient, and drug. It should be like that. So the one of the challenge what we are facing when we are applying yoga is that the one is the importance of yoga. We need time. For example, simply we cannot like a consuming a medicine. It will not take much time, but when they want to practice yoga, at least it will take 45 to 1 hour. So people are what we can say, they are little bit reluctant to spend their time when to practice yoga or other physical exercise. That is one of the challenge when we are facing in the field of yoga. The another thing is like when we are expanding the awareness, like significance of yoga to improve the immunity. Particularly, yoga is more than the, of course, but more than in the curative aspect. It is yoga working wonderfully in the primordial and primary prevention of the diseases. So the government has to develop such a kind of policy that, like developing the public area, so that people can come and practice yoga and other physical activities. So such a kind of policy, lack of policy also we can observe. So the government has to take
such kind of initiatives. Particularly in the urban area, they don't have much space in their home to practice yoga or do such kind of other physical activities also. So that there should be some places so that they can come and practice yoga. It is not like a gym, but they like what we can say, park kind of a peaceful atmosphere. Such kind of things government can think and they can develop. And the another thing is in the area of research. Like when we are understanding a subject systematically, in the yoga, what we are nowadays, what is happening, every research is focusing like before after effect. For example, effect of yoga on diabetes. So assessment is pre and post, and result may get like glucose level is reduced or some other parameters is reduced. But the studies are not much focusing about the mode of action, how the yoga particularly acting on that particular parameters, what kind of chain reactions are happening to get that kind of result. Such a kind of orientation is lacking in the area of research. So the the experts in this field, they have to develop such kind of concept so that we can understand in the other system also, in Ayurveda also, Siddha also, when we are instead of trying to understand before after mechanism, if some importance we have to give to understand the mode of action also, it is little difficult comparatively to assess the before and after effect. But such kind of effort we need to understand the mode of action also and related chain reactions. So these are some of the important points I want to share with you. And thank you very much.
Very, very good. Thank you very much. So basically, now we have a certain guideline. So we have yoga as like an icebreaker, and if we get all the systems together, I mean, we can, you know, at places where people are already willing to take yoga as part of their lives, they are more willing to take yoga therapy into their lives, and over time get kind of to know all the other systems if they are part of that atmosphere where this all is being offered. So, I mean, if it's in India, it can be done by governmental help, probably because there is an Ayush ministry, etc. If it's in the West, where we, as I said, have a lot of yoga going on, people are willing to see the point. But yes, there should be those higher standards. There should be a higher definition of the protocols, the guidelines, and the ways that these systems interlink and work together. So this could be a real way to move forward by maybe taking that piece of these systems that is already well known and taken into the system. So let me get to a second question. Let's see where we get with that. How far we get with that, because we have so many points that are just great and brilliant. So just to each of you yourself, what are the challenges that you have practicing your science, and also the challenges that you face as far as the research goes in these fields. So please, the same round, let's start with Dr. Arula Mutan. So in your personal view and in your personal life.
When we practice that traditional medicine, as the previous speakers, doctors told, all the patients, it's a polypharmacy. I mean, multiple medical systems are here. So medical pluralism world. So the patient, some other way, they are mainly connected with the modern doctors. So there they have most of the diseases, they are under their treatment. And some part they come to our traditional medicine treatments. So they have to be, so it's modern doctors expect the patient should be under their control. So there is less coordination between that practitioner and us. So what happened? Usually a medical doctor should decide what treatment, when, how to initiate to his patient. So here it's not happening. So finally patient is deciding. Decision is taken by the patient. Whether it is right or not, that is the question here. So he will, he has to go against one physician and willingnessly, voluntarily goes to another system. So that is what our, even though in India all systems are approved, this is the level. Among the practitioners level, there is no coordination. They don't know about other systems. So they don't know when to refer, whom to refer, which system is good. And along with my medicine, now which doctor I can refer, these are actually lagging. So patients are suffering a lot. So what happened here, either a allopathy doctor or other traditional doctor, he will say, first let you finish my treatment. And he will try his maximum, and when it fails, if it works, it is good. When it fails, then he refers patient to other system. Suppose had the coordination among these two systems or doctors happened earlier, sometimes mostly we could have overcome the disease for that particular patient. So this is the one thing in the practice level. And patients also hesitating to tell the other treatments simultaneously what he is taking, because sometimes doctors may behave rudely. Why you are not respecting me? Do you think I'm not having knowledge? And you are going that system, this system, you don't come to me. So these are the some of the unethical or unprofessionalism, I say. So because they are not aware about the other system. So the doctors should have should be given an adequate knowledge about this thing. That is what I feel. So this leads to therapeutic failure many times among the patients. And at the last, as previously some doctor mentioned, everything after trying with the modern medicine, and the last, when they just send the physical body to us, do something. Or if you want to try Ayurvedic or Siddha, now you try. They will tell the doctors at the last. So it is actually should be considered as an illegal. Even it is that serious actually. I feel that serious because the patient's life. So that is the one point I just would like to point out here among the practitioners level. And when it comes to research, really actually in modern medicine they will go, they will believe like a reductionism. I mean, single molecule is the drug. When you tell about a herbal, it has more than 5-10 molecules, then it's not a drug as per their definition. So so their systems like molecular docking or in vitro studies or animal experiment, pharmacokinetics, many their research parameters are what they have established as a research tool. They are actually for that single molecule research. But when we do a research from the traditional medicine, we actually struggle a lot, and we try to put this leg into that shoes, and it may not fit many times. I have good experience because I am from traditional Siddha medicine education background as well as modern pharmacology and working in the integrative setup. So I know this how it's very difficult, and they are asking to prove in using that tool. And we don't have our own tool. For example, in the immunity itself, If I want to prove the particular herbal or particular yoga therapy or particular lifestyle, it is immuno boosting or having immune elevation or immunobalancing state, then we can check CD4 count or something. That tool only still available. We don't have a other well-being or common tool in our system. Each system, I'm telling for all the traditional system, we don't have any diagnostic tool to say, yes, you have immune deficiency. Out of 10, you got 7, it is deficiency. We don't have any tool. Or to assess the drug, yes, you have to, the point is raised. We don't have actually. Even Nadi system, we say we practice, but there are many instruments are available, but still those are not satisfactorily giving the Nadi parameters in a graphical level or in a digital level, so that we can refer it in future or that will be a good documentation. So we are actually in the research side, we failed miserably to develop our basic ideology, basic philosophy. We just try to prove our drugs. So there is where we fail. So in that perspective, the research side people, they should really take this as a serious matter, because here just giving the drug will not work. It is just 50% only. Remaining 50% are there in the patient's hand, and environment, diet, so many things are there. So this is what holistic. So in that way, even the research parameters, research tool should give some importance for the basic philosophy of our systems. So for example, Tiridosha, Vada, Pitta, Kapham, when it is balanced, he is having good immune, we say. And how to prove Pitta is reduced, Pitta is increased? So I know, in my patient I know, but even I am not able to show to my patient in a paper or in a document. And I'm not able to show the improvement in my treatment to other scientific world. So this is how I feel that the government or other research organization give little focused research on the basic items of the traditional system. So that will be actually more useful for the research purpose. And another thing, integrative medicine, really now it's unavoidable. We cannot say my medicine or that particular system is a holistic or it's a fulfilled. Definitely now we have to live in a medical pluralism world. Patient has to take one or other system of medicine, one or other sometimes. So the integrative, when we take two medicines, patient take two medical systems simultaneously, what happens? What reaction? It's a synergistic, antagonistic, or anything where the interaction happens. Or these are the queries should be addressed from the research side. So in the patient also, so here patients are well aware about traditional medicine. They believe it, they commit, they are coming. So the focus or the future, the awareness is not for the patient, it's for researcher and doctors. That must be that must be done to promote or to bring the integrative harmony. That is the important point I would like to put it here. Thank you.
Great, thank you very much. So now, basically, the group that we built with all the traditional medicine systems to find the right cooperation and communication. Probably it would be best for that group to do a research together to find a certain ways to establish these ideas, values, and parts of their systems into the holistic idea of health, and over time to be part of the standard health system. And also on the practical side, I understand probably it would be best to have at least one, in the best case, all the systems as a group attending to each patient to look at the same time before the first diagnosis, before the first steps into the treatment are taken, to have these the points of view of everybody. So I mean, of course, people feel like too many people might make things more complicated, and then you never get to any point as every democratic system would be. But there should be ways of cooperations, and so I understand that by what you said, and really, I mean, probably India should be able to do that most, because at least there is a tradition of these kind of medicine, and also there is a governmental body working with it. So maybe over time, but still, all the points that we mentioned before need to be done. You know, some real standards, some real protocols, some real basis of cooperation, some real understanding, and maybe this is what we can do here. So to have a platform where a first basic understanding of each other can be established, and over time it can go deeper, and some cooperation might come out of it. So thank you for that. Let's go over to Dr. Piyush. What would you say about your personal challenges practicing and researching?
See, in fact, there are so many aspects which already been discussed on this platform by all the other eminent panelists. However, there is one specific point which I want to mention here, and that specific point is also related to the challenges as well as to the research. In fact, let me just tweak the question, and let's understand. See, whenever we talk about research in any medical science, be it allopathy, any other system of medicine, there are broadly two kinds of research. One is the academic research, another is the industry sponsored or commercial research. Now, if we talk about academic research, those academic research are predominantly based on the aim and the objective is to identify and maybe re-establish the physiological aspects, the pathological aspects, some mechanisms. They are more into science in terms of landing up in some findings. Sometimes we have seen academic research being taken to the next level by the industry people, and eventually a drug has been launched. So this is the entire scenario and blueprint. Because if we talk about research, it has to be funded with huge amount, then only we will be able to get a good final medicine. Because see, these days the era is of global clinical trials. So from the preclinical, if we can understand a journey, so from a preclinical phase to a clinical phase and to the market, a particular medicine or a particular drug needs to travel for few years, and there is a huge amount of funding is required. Now, again, we need to understand. So in the entire scenario, whenever we all can say that, okay, our system is lacking research, our system is having less research, or we don't need research. Some senior Vaidyas or maybe Siddha or Homeopathy doctors are saying we don't need research. Why do we need to do research? It is already mentioned in our text. It's already mentioned by Maharishis and all. Why you are doing research? Why you need research? It's already mentioned that this drug is effective for this medicine. Just give it and do the practice. So, but the point here is, to the latest world, to this new world, I will say new as compared to the 5,000 years ago when Ayurveda has been written. So this new world, if they need to adapt Ayurveda or any system of medicine, they need to understand in their own language. And the today's language is of the research language. So they understand the science, they understand the research, they understand the parameters, they understand the pathology parameters, radiological parameters. They need to see that, okay, my tumor size is decreasing. They need to see my blood levels are improving. You can't just touch the nadi and say, okay, you are healing fine. You are completely healed now. No, that will not happen. You have to prove that in the pathological, radiological or investigational reports to the parameters. Now, if everything will be involved, then definitely we need to do research whether our medicine in Ayurveda is able to lower down the lipid profile or LFT or say tumor size or whatever. So that means research is required. First question. Now, again, we need to understand when these researches have been done. So predominantly, the allopathic system is categorized into two parts. One is the OTC, over the counter, and another is the prescription based medicines. And see, if somebody is investing, be it an academic institution, after that company is investing huge money, they need return. It's a pure business. In any business, in any domain you go, you have to invest and you have to get the return. We are not saying that do unethical practice ethically by promoting in the market or by treating a disease. Ultimately, the return will come to the company, and that's why the patent are there to secure that investment. And this is the entire ecosystem we need to understand. Now, the problem with Ayurveda and some Indian systems are the entire system is OTC. There is no concept of prescription, the value of prescription, because simply you can buy any medicine. If you, for example, I just quote one example. I don't want to name any website, but you go to online pharmacy in India, a simple allopathic drug, that is cetirizine, which is a drug used for anti-allergic, like allergy issues, and simple anti-allergic drug, you can get it with any medical shop easily. But technically, it's a prescription drug. So at least all the online pharmacies will ask a prescription, then only they will, you'll be able to complete your order. So that is a very good implementation. At least we are moving to the digital, because physically we can't handhold the entire population, hundreds of chemist shops. So few decent brands of chemist shops pharmacies are practicing that in India. That is fine. They don't give prescription medicine without prescription, but sometimes it is a challenging in the physical world. But those can be very well maintained in the digital world. So these online pharmacies I respect them very much, that they are each and every allopathic medicine without prescription, they are not giving you. It is mentioned that it has to be taken with prescription, and they are only giving the OTC medicine online. But the problem in Ayurveda is the entire system is, like, you can get any medicine. In fact, those medicines who are mentioned as Schedule E, you can get without prescription. Now the problem is this, and let's connect this to the two challenges, two questions. One is challenges, one is research. Now, which company will be interested in investing huge on research, but if they know that anybody can get it without prescription, so they will be more interested in getting the product launch, position it as an OTC, do huge marketing on TV channels, newspapers and all, and directly go to the people that, okay, I can heal your joint pain, I can heal your stomach, I can heal your skin, so and so. Till the time government will come up with, say, okay, at least these medicines, these set of medicines are only prescription based medicine, and then it is a challenging for Ayurveda as well. Now I do a consultation, and like people pay me my consultation fee, and when they get the prescription, they see, okay, this is my lifetime formula of treating so and so disease. Now I don't need to visit, or maybe I can just repurchase this and get myself healed. And sometimes they, in fact, many patients, they don't bother to take a consultation as well. They just maybe verbally listening somewhere to some typically babas. I don't want to again comment to any brand, but the point is they are listening, okay, this medicine is working well. They have listened to a TV channel program, or they have read somewhere in Ayurveda books or whatever. And they said, okay, this is fine. Let me start this. And in fact, many people have come to us that, okay, doctor, I was taking this particular medicine, but it is not helping me out. So then why a 5.5 year degree course equivalent to any good like MBBS, the government has done BMS. Why we are doing that for 5.5 years? Why we are doing 3 years of PG? If somebody can just see an ad and get a medicine for his joint pain, or so the challenges at the bottom line is this. At least, see, there is Schedule E. Government has written that at least you can have these drugs with prescription, but the implementation maybe is some kind of a circular or reinforcement. We are fighting this from last few years. We have written multiple times to the officials, and they are saying, okay, we want. I respect, in fact, upcoming field of medical cannabis in India. I respect all these medical cannabis companies. On their side, if you go, they will always ask you a prescription. They will not dispense a single cannabis medicine to you without prescription. So at least that set of herbs and that set of category in India are now developing ethically. And that's why in medical cannabis, people respect doctor, people respect prescription. They come up to us and take consultation. And in fact, in medical cannabis, good research studies have already started at a very big level in India as well. And it will grow, and you will see some results in future. And if you see worldwide in US, Canada, and many other countries, it has been researched. One of the most researched herb right now, if you talk about in the entire globe, one is in top 3 or top 5, you can say one is cannabis or Vijaya or hemp or bhang or whatever you want to say to this. So the reason and the bottleneck is, until or unless we have a respect of prescription, the government will have mandatory, maybe through your channel, open attempt or knowledge festival, whatever you people are combining or correlating, at least convey this to the Indian ministry or government, that at least we can have some set of drugs which are prescription based in each system of medicine, be it Ayurveda, homeopathy. Some homeopathy actually have some advantage because they do some permutation and combinations in terms of giving the medicine. So at least they have that advantage and patients go to the doctor. But still, I have seen many homeopathic drugs are being sold as OTC also in the chemist shop. But in Ayurveda, actually in Ayurveda also many Vaidyas and many people are doing that kind of a blinding or permutation and combination that they are doing, but they don't do that. And again, the new age Ayurveda, the challenge is they need packed, well labeled what is there inside the bottle. They need to understand that. We can't give them the blinded tablets or churnas or you just take this, it will help you. No, that is not more acceptable. Some traditional Vaidyas are doing that. So that is one kind of holding the patient, because again, we need to make viable, we need to make private practice is very, very challenging of Indian system of medicine in India. The private practice is very challenging and you can't sustain or you can't make it viable until or unless you have these kind of edit checks. So at least if we have some set of medicines that are prescription based, our prescription will hold some value, some importance, and that will retrospectively, or we can say prospectively, yield to better research studies, because again, the companies are also having that understanding that if we are investing something on research, we will get a return. We will get a return in a systematic way, in ethical way. So the problem here is then companies are also not bothering. They are also saying, okay, the big giants are saying, hire a Bollywood celebrity, give them the bottle of this particular oil, and let's promote that. Why do we need doctors? Why do we need research? So that is the entire mindset which is coming, and you will not see any allopathic pharma company or an allopathic medicine. They can have a generic advertisement, that is fine, or maybe some OTC cough syrup, maximum to a extent of a pain ointment, that's it. You will not see entire allopathic being sold at television channels or like an OTC, because at least they have their regulations in place. So that is one bottleneck and one basic challenge which is there in the practice, and which is also affecting good research studies. If we are able to at least have some maybe 50-100 medicines on record that these are the prescription drugs in each system of medicine, and patients can't, and by the way, we need to understand, we have ras aushadhis, we have medicines where heavy metals, where some toxic plants are there, but almost all are safe. I'm not saying that these are harmful, these are safe. These are nano medicine form of medicines or purified like form of herbs we are using, but these are sensitive enough not to being advised without a prescription or without a doctor guidance. At least those should have the prescription, because sometimes when we argue, the government people or the company people are saying, okay doctor, why you are saying Trifla is like simple harad, behda and amla, and why you need prescription for Trifla? Anybody can take. Why you need a prescription for maybe Giloy? It's a very simple herb, anyone can boil that and take that. So I agree, okay, you can't have prescription for all these simple herbs, but at least have prescriptions for sensitive medicines, for those medicines where the ingredients are a bit sensitive. They have ras aushadhis having like heavy metals, mercury, all these are purified, and we have done testing at our clinical level that whenever somebody is taking, there is no damage to any organ. By the way, if company is doing in a standard way, there is no toxicity or there is no presence of heavy metals, because we get this challenge. This can be one more challenge, in fact, in the challenge points, that we get this challenge and we get this negativity also, that Ayurveda medicine sometimes have heavy metals, they can damage our kidney, liver and all. But on the contrary, they are not doing that. They are protecting somehow, and we have done at our basic clinic level, we ask them to get the pathological testing of heavy metals in your body, and after taking 1 or 2 months, 3 months also, they are under control. So that means they are not affecting their organs, and these are all purified form and safe form. But at least for those medicines, let's have prescription mandatory. When it will start, at least the online pharmacies will follow. Gradually, the chemist shops and the other people will also follow. If they will not follow to some extent, that is fine. They are not following the entire allopathic, or that is again a different question. But at least the society will have an image or a mindset, and that will also impact for good, genuine research studies, and the entire ecosystem will be well balanced and maintained. So I think that is my right now specific point which I wanted to share, and that should be advocated, and that should be like communicated to the authorities, because if we are able to at least do that, that will definitely help the entire. And in fact, finally, and again, I'm not bothered about the fundings. I'm not bothered about the practitioners growing in a practice. I am bothered about the end user, the patient. They will be safe, and they will be at least having a genuine pathway to follow. And we have seen drug societies are tremendous in COVID. We have seen specifically our clinic was again selected as one of the highest rate, in fact, in terms of the COVID management. And we have used exhaustively drug societies, and we have seen brilliant results in COVID cases. Right now, also we are using. I don't want to claim anything right now on this platform, but the point is they are fast. Like I think one of the fellow panelists was mentioning that aspect, that people generally see our Indian system of medicines are a bit slow. On the contrary, research are fast, and we are seeing results many times within few days or few weeks in terms of in pathological investment. By the way, in COVID time, their RT-PCR values, their oxygen saturation was improving significantly within 2 to 3 doses, and they were off from ventilators. We have given some patients were on ventilator or oxygen support. They were off from that within 2-3 days, and all these case studies and everything is there. The point is they are fast, they are effective, they are really helpful, but under the medical guidance and the supervision. And until the time government will not make prescription mandatory, again it will be in a gray area, and that's why people will not respect the doctors, as well as companies will not have specific approach to develop more and more medicines like that, so that at least they can ensure that they are getting returns, or they are getting a ecosystem where they can secure, because otherwise they are not secured. So you never know if they have that prescription model, they are secure that at least all these doctors are now prescribing, and accordingly they can get the returns. So that is very, very important. Thank you.
Thank you very much. So this is a very also a viable idea to, of course, have certain formulations prescription-based, because also, which is very understandable, these formulas can be harmful to people in certain situations, and also, as we already mentioned, the quality standards and the protocols for production and research, so that yes, big at least companies, maybe bigger companies, are incentivized to get into this business and do some research to make it clear. So also that some people just know, some people are the old generation is believing in the scripts and the scriptures. So, which is fine, and it might be experiential knowledge that always has worked for them, but to make it an international effort to bring it to everybody and make it part of the whole system, it would be a good idea to do some prescription drugs there. And Indian government probably can do that if they are willing to. But I think that will be a very political and a very much a big business decision that we can only work slowly towards. But also what Dr. Arulamutan before said, that with the all these things like the ojas and the ama and the nadis and all these things have no way of research in them, and maybe there can be found ways to do research, and then maybe you cannot, let's say, show ama or oja or anadi, but you can kind of see the changes in certain situations, see symptoms of more ojas or more ama or a working nadi here or a non-working there, whatever. So maybe those tools would be important to maybe for as Dr. Piyush just said, it's for the older generation, it might be laughable to go about many of these things with these kind of ideas, these kind of attempts to prove them, because they just see it in a different way. But yes, as a part of the whole system worldwide, we need to find ways to communicate with each other and also to bring people into this thing, because the more people are part of it, the more we can really go forward with it. But great points. Let's move on to Dr. Mehta. What are your personal challenges and when it comes to your practicing and your research work?
Recently, we are coming up with a lot of good research nowadays. But the thing is, when we are forced to show our research on the base of, the kind of research they do, their research model, it is not possible. But recently we have come up with a lot of good researches where we could show the action of our medicines on the cell lines in vivo and in vitro studies. And we were also, it was claimed that there is no medicine. Homeopathy is placebo. So we could also show, we worked along with the IIT Mumbai, and we could show the ions in the electron microscope that the medicine is there. So, but the thing is, we need more studies. For that, we need more money, more budget from government, so that we keep on trying, because it requires a lot of investment also. So we are working on it, and the biggest challenge is, like all the alternative medicine people, they know a lot about the modern medicine, allopathy. How do they practice? How do their medicines work? What do they prescribe? What are the side effects of their prescription? But these people, they are so much scattered that the doctor who treats the head and neck is not aware of the, he himself doesn't know how to treat malaria. A doctor who is a cardiologist, he cannot treat diarrhea. They are, they feel themselves, they feel lot many times handicapped. I have spoken to a lot of neurosurgeons. They say, bloody, I can't treat a diarrhea. What a man I am. I can only open skulls, which I don't want to. So there is a lot of problems. They don't know what we are doing, because being such a high-posted people, they are able to do a lot of things, and they don't have a clue what we are doing. So whatever we say that we have treated, they feel it fake. So they need to learn what we are doing. Then only they will believe, and they can refer their patients to you. Why would they consider you intelligent than them? When they have, they have read it so closely and they have tried their best. According to them, there are 5, 10 medicines, what they know. They don't understand that how can they refer. There is no fault. Because, right now I'm working in a cancer hospital. So now I'm working with the, doctors, where when they really want to get rid of the patients because the pains are immense. So they send the dying patient, terminal patients to me. So there when, they send me some patients, they say, oh, he's taking, a lot of morphine, all the painkillers, he's not getting rid of pain. I don't know what is happening. Then I realize what is the kind of person, what is his concern right now. He is worried about his property in mind, which he has earned. Now people are enjoying it. That is the pain in the mind. He has been given radiotherapy, which has burned the cells inside, and now, according to Herring's law of cure, that is forming a pus and coming outside, bulging the skin outside, and it wants to break up, and they are not letting it break up with their medicine. So it is creating a pressure pain. So when I give a medicine, there is a boil is going to form, it is going to secrete the pus, and then slowly the patient is off these painkiller medicines. So then they understand, oh, you have something. Maybe you're a good doctor, you know how to speak to them. They feel better with you. So now they refer. Now some doctors try to understand, oh my God, you have phosphorus with you. Oh, so you dilute it to this level. Okay, my patient had good experience with that. Okay, I'll send my child to you. So this is how you interact. You don't have to, you don't have to attack their ego, and try to understand if they are getting, some harsh words in their mouth. They don't know you. So if they'll interact and when they get to know you, they will definitely, refer patients what Dr. Arul was saying. So now I'm getting referrals from them. So some people ask, okay, if you can manage the pain and suppuration and the terminal case, if we'll give you some patient in the initial case, can you handle that? So let's see, both of us will see, both of us will watch. So maybe some of his relatives, whom he don't want to send to chemo or radio, maybe some elderly, he can bring that patient to you. So this is how it works. Are you getting
you came back.
This is a way how we can integrate. There are a lot of gliomas which cannot be operated. Their signs and symptoms cannot be treated with conventional medicine. But when we start treating the patient according to the nature of the patient, according to the ailments he suffered from, was that from a shock, or he fell, or he got an electric shock. So when we start treating, the symptoms are controlled, and patients sometimes live for longer, and the scans shows that there is no further growth and regression. So it will take time, but the thing is, the allopathic practitioners, if they get to know us, then they can refer us, and this can form a very good, integrative system. Then we can have a better thing to go on.
All right. So thank you. Yes, thank you for that. This sounds a little. It's good to have a woman here, because it's probably let's say women in our world still have to be a little stronger and better to prove themselves as adequate in a man's world. And maybe it's the same position for these medical systems, that they have to prove themselves more to be seen as adequate. So it's the basic power of women to see that possibility, to not let that ego and all that, also maybe righteous anger about situations get in the way of the practical world around them, to just get to a practical point wherever it might be. So they throw the toughest patients at you, so then you will have to handle that. And once you have some results, then they will refer more to it. So, sure enough, it's a tough and long road also. But yes, that sounds it sounds understandable. At least I think we should go from both ways. One side would be the individual kind of effort to really make a point of the quality of your work, so that the more people from other systems, from modern medicine especially, see the point in working with you, but also maybe go the governmental ways, try to get prescription formulations to put more weight on the system, and yeah. So from both sides, and also on a regulatory level, finding governmental support in certain guidelines and regulations for production of drugs, and also treatment of patients. So thank you very much. Now let's go to our final opinion from Dr. Shri Harisukesh, let me know what are your daily challenges, if there are any, in your practicing and research work.
Okay, thank you. As the continuation of Dr. Piyush Juneja ji and Dr. Amdat. So, like, same problem what we are facing in the field of yoga also, like Dr. Piyush Juneja ji explained, like without prescription, how they are using the medicines, and maybe it can create some kind of complication also. Even they may not be aware about that complications. Such a kind of problem is existing in the case of yoga also. Like that, nowadays everybody is like, if there is a stretching is involved, then it is called yoga. Okay, so there is no differentiation between stretching exercise and yoga. That is one of the very big challenge what we are facing as a yoga therapist now. So, like we can see every day, we can there are people are like competing each other to find out new extreme level stretching exercise and calling it as a like yoga asanas. Okay, but there are lots of other traditional asanas are there, but completely neglected also. Okay, that is one of the challenge. The same thing when it is coming in the practical level, like people are like nowadays it is like hot yoga, beer yoga, so many things of yogas that giving the wrong conception, that conception about yoga, whether so it is like affecting the people whether what is actually yoga. So that kind of that is there. So same thing, like another thing is like when we are practicing yoga, like Dr. Arul Amdan said that modern doctors, they want to the complete control over their patient. They want to allow to choose other options, so that when otherwise the patient has to decide. The advice will not go there. So that is why what happens if suppose particularly when I was doing my research on the effect of yoga therapy on the degenerative lumbar disc disorders, those people who are suffering the chronic backache because of the degenerative symptoms in the this lumbar disc area. So I was searching for people, but they are not at all ready to come for the experiment because they got the guidance that don't do any such kind of exercise activities, etc. So, but those who ready to come in the practice, but they got excellent result. So I am I'm remembering the one person who was more than 1 year the complete rest in their house, but that he becomes very much socially active because of he become so agile and flexible. So like that, when we are applying such kind of techniques with therapeutic aspect with complete attention, it definitely it gives result. But there should be an open mind to integrate such kind of things. Particularly now we can see in the case of corona also, the Ayurveda and other medical system are not in the beginning, they are not at all allowed to even to prescribe medicines that will improve the immunity. They cannot use that it can helps to prevent corona, like that kind of system was there. So there should be an openness in the case of integrations. It is like the patient is important, overcoming the disease is important. That kind of awareness has to be there in among the medical people also. Same thing, the awareness in the public also. So that is the challenge what we are observing nowadays in the case of yoga. The another thing is like in the case of research, like what we can say, the modern medicine is mainly seeking the empirical solutions, like what we can say, symptom-based treatment, but the traditional medicine is mainly focusing like what we can say, they are basically developed from the Sankhya concept, etc. They are seeking the fundamental solution, like Dukkhatraya. The basic concept is like overcoming the Dukkhatraya. So all the Indian tradition, even yoga, Ayurveda, Siddha, everything is seeking what is the fundamental solution. On the way to reach that fundamental solution, some empirical solution can be attained. So only few occasions we can observe like seeking a quick relief, but in most of the case, all the disease, we can understand that they're treating, the focus is very deep-rooted, seeking the fundamental solutions. So because of that, the scientific, the strategy of the treatment also, because of that, it differs. So we cannot compare the treatment strategy which seeking the fundamental solution and which seeking the empirical solutions. The modern medicine is developed mainly not only because of the medicine, they have lots of technical supports. They have developed lots of instruments and biochemical experiments they have done. Everything, the end result is enjoying by the medical field. So they have a huge support is there behind their back. Same thing we have to develop in our Indian system also. For example, like Dr. Arul Amdan told, it is very difficult to prove our concept. But unfortunately, the scientific community has to think in consultation with this medical field, how such kind of instrument, device support, we can also develop so that we can prove the mechanism of our concept. I don't know what exactly it will be like that, but how the parameters, the instrument developed to support the concept of modern medicine, the same attitude we have to follow in our system also. So for example, I'm not telling that is authentic parameter, but like there was a Kirlian photography, some other things like assessing the pranic aura, etc. like that. Some effort was there, but then after that, such kind of effort is decreased. So what we can say, we have to develop, the scientific community in India has to focus to develop the instrument which will help to prove the concept of Indian traditional system, the impact or effect of the Indian tradition or the basic concept of the Indian traditions. Unless we are only focusing the before after, like we cannot use, we are not eligible to use like a cholesterol, glucose level, like diabetes, because in our ancient concept there is not, these words are not there, but similar things we can correlate with same concept. But what we can say, the mainly like prana, vada, pitta, kapha, pranic movement, etc., and other concept in the Siddha also, Ayurveda also, in yoga also, to assess that, to describe that systematically, the exclusive instrument we don't have at present. So that the scientific community in India has to focus, and government has to support such kind of attitude, so that we need not depend the instrument which is developed for the another purpose, in the another terminology. We can India or in our we need a supporting system, instrument supporting system, which is developed exclusively to prove our concept. So such a kind of development is lacking in our system. If that is happening, I think some of the problem we can overcome, particularly defining, etc. But it took lots of time. It needs time. It needs support, government support also. Okay.
Yes.
Thank you.
No, thank you very much. This was really brilliant, because first you told us about your challenges, which is of course the other part, the other side of the thing, because yoga is very well known nowadays. So you have to deal with people who have a wrong understanding of certain things and who might believe this is yoga and that is yoga. And it's just the total different area than Siddha, maybe, where somebody just doesn't know what it is. But with yoga, everybody think they're a master, and they can stretch and bend, and that's it. So that's your personal thing. But also, I think with the with the research part, so that I mean, not only that you were also putting an emphasis on finding the ways to articulate all these things that we are talking about, and to have a research-based thing about it. But then also that the modern medical industry, that there is an industry around this, building things, producing things, the whole set of productions that is coming up, not only with tools, but to be, as an economical point of view, there is a lot of work to be done, and a whole kind of a lot of money to be made. So actually, if let's say just the Indian part, because we have many ancient systems of medicine that could do the same in their regions. So if now the Indian systems come together and have this idea of let's say designing certain things to work with, and that makes build some kind of industry around this whole thing, then I mean that can bring things into another level, because then you could put also some pressure on governments to come in with money and with support. And I mean that might be a brilliant idea to reinforce these possibilities of these medical systems by giving people jobs and bringing money into the game for some good things. So that I'm really baffled actually with each and every round. We had brilliant ideas, and I'm so happy to have hosted this with so many great people and great minds. So Vinayak, would you like to add something before we close the show?
I think Dr. Mahesh would like to say something at this point, and then yes, I can summarize it. Yeah.
Sure.
Sir, go ahead. Yeah.
Yeah. Good evening, and very thank you for the overwhelming talks that we had this evening from 6:30, and I would like to thank all the experts who are there on the platform. So basically, I was hearing all their really brainstorming things that we had. So one thing that I would like to add is, modern system, whatever gadgets or equipments that they have, is not developed by any of their doctors. It was done by scientists for a different purpose. In fact, it's not, none of them were done for the medical purpose. Basically, X-ray was done to know the metals in the earth for mining purpose. And that turned out into a medical purpose. That's the basic, with the small tweaks and different improvisations. So what my basic thought, what I would like to put here is, in the same way, all these gadgets can be used by any system, irrespective of whether it is Ayurveda, Homeopathy, or anything. The readings may be the same. Only thing is the interpretation of the readings. How we interpret and how we make it suitable with respect to our principles. That makes the validity of these instruments to us. For example, if there is, say, for example, we use these phytochemical evaluations. And why do we need HPLC? Is basically we need to ascertain the quality. So we can understand what quality is the drug, what quality is the plant. And when we can improvise on these gadgets with respect to our own policies, it will be easier for the even to develop a protocol, which is clinical protocol for ourselves, for the on the basis of these principles. I would like to just take the example of one action. Every action of Ayurveda is a multiple facet. It is not a single faceted. So there are many things that is there in that. So we have to explain what are the branches of this individual action and equate it to the available gadgets. So why we need gadgets, why we are now dependent on gadgets is, earlier the people were having belief on the physician. They were not asking anything, that I should agree. Second thing is, even the physicians, they were having the siddhi, what we tell, which is much more important and much more perfect than these gadgets, in fact. But unfortunately, we have lost that. I should tell that we are not having that power. So we have to depend on gadgets. But the gadgets should be tweeted, improvised, such that it is useful on our basic scientific lines. Every science has its own contribution, and I think adaptation to that makes it Yuganurupa, even in the science which has stayed for all these years. This is first thing. Second thing, why we don't have certain things, like, because Indian GMP, there is nothing, no specification as who should be the Ayurveda expert. It's only Ayurveda expert. It's only one line actually. So where the expert of the Guna is not there, expert can be just a simple graduate. So specialization is not there. So specification will be differing with respect to an undergraduate sitting over there and a postgraduate sitting over there. There's a difference in that. So this is another thing. And because of which the quality of medicines differ, many things happen. And as a result, the faith on the medicine by the physician itself will not be as strong as a modern system of medicine, because modern system of medicine goes through a strict parameters, and an informed people, I think Dr. Arul would agree with me, that specializations are respected. That is the basic, which we also need to understand. Specializations, when they are respected, they will be given equal status, and these specializations will contribute in a more better manner than a generic attitude, and that ultimately develops the science. We don't need a separate instrument. We need to improvise on the instrument, but improvisation is to be done by a specialist of that particular area or a science. It cannot be done by a general scientific person. He will only give you the gadget. Similarly, even the medicines has to be done by a specialist who is a specialist of that area. And then only the quality will be enhanced the quality will be assured, and this assurance will also give an assurance to the practitioner so that even he can give the medicine with ease and confidence. That will contribute much more strength to the science, and it will help in the, irrespective of any science, it will help in the growth of this science. So this is something which we all have to understand, and we need to also see that when we integrate something, there is no necessary that our basics should be integrated. Basics can be different because that is why we are different. But the ultimate goal as we need is to give the cure to the patient. That is it. So irrespective of anything. So where what is to be given, that should be the protocol, and that will also make the science have its identity along with giving utmost benefit to the patient. I think I will end up with this. It's over to you, Wes. Thank you.
Thank you very much, Dr. Mahesh. Very important part of the Open Attempt organization and of the organizing team for of this whole knowledge festival. So, Vinayak, now.
Yeah. I mean, absolutely, we had some great talk. I mean, this is a topic I think we can speak a couple of more hours, but I think all of you are busy practitioners, so I'm not going to take much time. First of all, I want to thank all of you for taking your time and being with us here. As you know, I mean, the last 6 days, I mean, we went really deep into the subject, you know. And when we choose this topic of immunity, the idea was not to just think about immunity, because I think I don't know if you participated in the whole process, like let's say development of immune system. So when we are talking of development of immune system, it's not, we cannot isolate that. So the idea was to actually speak about all the aspects that come into play, you know. So we talked about the role of genes, we talked about the role of mother's nutrition during pregnancy, her mental states during pregnancy. So that applies not just to immune system, but to everything else. And then we also spoke about aspects like nutrition, environment, mental health. So a lot of non-medical approaches, you know, which were important. And only in the last part, we spoke about medicines or therapies, you know. So because when we want to think about treatment as it is actually, so these things are fundamentally important, that we focus on not just the medicine, but also other aspects, which also requires us to, you know, change in a big way in terms of like also as a society. So for people who are listening, actually, the audience, I mean, yeah, I want to end with something simple, because, you know, when you say knowledge, there was an ancient formula given in the ancient science about what knowledge means. Because whatever you're hearing here, for example, you know, from all our experts, if you read from a book, if you see in a TV or something like that, you have to consider all this as information. That is only 25% of knowledge, you know. So you heard something that meditation is good for you, you heard that exercise is good for you. It is just information at that level. What you should do, you should go back home and do some self-study. See, today we live in a world that there is enough information to actually help you understand, let's say, why meditation is good for you, why exercise is good for you, or why you should eat healthy. There is enough information. Do your own research, come to this conclusion yourself, you know, that it is important for me, not because some other person told you this, you know. So when you do that, when you say, okay, maybe the doctor was right, maybe this book is right, when you come to that conclusion within yourself, you get another 25% of that knowledge. Today in this world, we live in a world where all of us know what to do, you know, but we don't do it. So the next 25% of that knowledge will come when you start to practice it. So when you start to meditate, when you start to exercise, when you start to eat healthy, you will understand the difficulties of doing it, but also the benefits of doing that. So through practice, you will gain another 25%. And the last 25%, Seshat Kalakramena, nothing will happen overnight, you know. So you have to give it time for these things to work. So if you put the knowledge in these 4 steps, what happens is it changes from an intellectual dimension to an experiential dimension, where instead of you understand to I know, you know, it becomes an experiential. So put this knowledge in those steps, to actually bring it into your own practice. And that will probably help you out to bring this knowledge into practice. And for us as an organization, our work is not finished. I mean, we are just begin what we are doing actually. So there is a lot of work involved after this. So we'll be getting back to all our advisories to actually help us prepare the first draft of all that we have discussed so far actually. And what we are going to do, that we are going to keep this draft open for public and as well as other experts to come and edit. So anyway, I will be mailing all these details down the line. But what I'm saying is that whatever we concluded in this conference in the last 6 days, we are going to prepare a small draft, kind of a scientific synopsis, which will be open for people to edit, correct, and add. So we will do that till we come to a place where we can actually bring it into policy making. So and that's why we want to convert this all knowledge into a simple language where actually even a child can understand how the immunity develops or what need to be done. And overall, down the line, that we bring that practice into a society, that we become healthier people, we become, and as I said, prevention is very, very important. And one of the best marketing, actually, especially from the health field, what we can do is that as health practitioners, I think we have to become the most healthiest people in the society. And that's the best marketing that we can do, so that you become healthy, and as a doctor, because also we see that a lot of doctors are unhealthy. They are actually prescribing things and stuff like that, but they are not doing that for themselves. So as a health field people, I think we have to really work on also that we become the most healthiest people in the society. So with that, I would actually like to thank everyone that without this, it was not possible. Like Dr. Arul, I mean, we met, I think, 8 or 9 months back in India when we really just started. And I really want to thank him actually to connect the whole thing. And this is the first effort. We brought 100 people together, and we have the first step to that, what we want to do. And I also want to thank actually all the paper presenters, because we had wonderful papers, and it was so much of learning actually. We still need time to process all this information to go ahead. And not last but not least, all my team, Wes, and Dr. Mahesh, and Romana, Davis, and there are so many volunteers who actually helped us out to actually make this possible. All of us are actually volunteers, we all have normal work, and we are all doing it, in the spare time. So I really want to thank everyone for the last 1 year to actually come together and at least make this happen in a beautiful way, actually. So thank you to everyone. Yeah, thank you very much.
Yes. Here goes my vacation week. So that was really a great, all in all, a great thing to happen. I also think we had a really, a lot of experience that we gained, which was great, which will help us bring more to this platform, put out more content. We will be, clipping out a whole lot of informational videos out of these, the papers, the discussions, single questions, whatever you could think of, plus the whole talks out on our YouTube channel over time. So there will be a database of knowledge that we could extract here. Yes, whatever didn't work, we might just go ahead and try to do a better job next time. Some things are just not working at the first time, but it's all right. I mean, we didn't mess up too heavily, so it all happened, and next time we'll go deeper. I really enjoyed it, and I'm also very grateful to everybody who made this happen and who was part of it. It was really a nice journey throughout these 6 days. And to all the viewers and listeners now and later on, just please go to the website knowledgefestival.org, to the YouTube channel, or to the openattempt.org website for further information, for videos from the pre-talks, the talks, and all these, and for what the next step will be when the next festival will happen, what kind of topics we will be dealing with, and so on. So with that, I say thank you to everybody. Have a beautiful time, and thank you for participating. Bye.
Thank you.
Goodbye.